Announcements to ensure that everyone has a smooth and enjoyable experience. First and foremost, we have simplified the registration process. You can find the QR code for registration located just outside the auditorium. Breakfast and lunch will be provided for all of you at the ballroom on level 5 at 1 p.m. after the event is completed. The nearest restroom will be next to the main foyer outside of the auditorium. And also the exit emergency for this auditorium is on the right and left at the front of the auditorium. Please don't hesitate to ask our friendly staff if you are lost or need any assistance. For your convenience, we have also made the event agenda easily accessible. You can scan the QR code displayed on the screen to view the full schedule and details of today's session.
In addition, we would like to announce that this event will be live streamed on YouTube via NIH Ministry of Health channel. Hope you can share this information with your friends. Thank you for your attention. Ladies and gentlemen, the opening ceremony will commence in just 4 minutes, so please take your seats. Thank you. Ladies and gentlemen, we also like to announce that we have provided drinking water just outside the auditorium. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon you and good morning. We would like to extend a warm welcome to the Honorable Dr. Rafiza Shaharuddin, Head of the Environmental Health Research Center, our esteemed speakers, distinguished guests, and ladies and gentlemen.
Welcome to the Environmental Health Forum 2023. I'm Amalina.
And I'm Faiz, and
We will be
will
your
MC
MCs for today. On behalf of the organizing team at EHRC, we would like to extend our sincere thanks to all the guests who have joined us for EH Forum 2023. To commence the opening ceremony, we will begin with the national anthem. Ladies and gentlemen, please stand.
Ladies and gentlemen, please be seated. To bless the ceremony, we would like to invite Mr. Rizwan Rodin for the Doa recitation.
Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Para hadirin sekalian, marilah kita bersama-sama menadah tangan untuk mengaminkan bacaan doa. Ummul Kitab Al-Fatihah. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Arrahmanirrahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma innaka khalaqul azim, innaka sami'ul alim, innaka ghafurur rahim, innaka rabbul 'arsyil azim, innaka barrul jawadul karim. Ya, dari awal hingga akhirnya. Ya fa'alu lima yurid. Kami juga memohon perlindungan daripadamu dari segala perkara yang boleh mencacat celakan majlis kami dan daripada segala perkara yang melalaikan kami dari berbuat taat kepadamu. Kepadamu juga kami serah segala urusan kami. Rabbana 'alaika tawakkalna wa ilaika anabna wa ilaikal masir. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wasallam. Walhamdulillahi rabbil alamin. Taqabbalallahu minna wa minkum. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Rizwan, for the Doa recitation. Ladies and gentlemen, in conjunction with the World Environmental Health Day celebrated annually on the 26th September, the Environmental Health Research Center, EHRC, proudly organized this forum as an initiative to provide insight into the emerging issues in environmental health. This year, our team, Be the Changemaker, Tackling Antimicrobial Resistance, aims to raise awareness and enhance the understanding of antimicrobial resistance among healthcare professionals. Ladies and gentlemen, now we would like to invite Dr. Rafiza Shaharuddin to deliver her welcome speech. Please welcome Dr. Rafiza.
Assalamualaikum and a very good morning to everyone. Ladies and gentlemen, distinguished guests, esteemed delegates, and fellow advocates of environmental health. A warm welcome to the Environmental Health Forum 2023. Environmental health is one of the largest fields within public health because of the myriad of ways external forces can impact our lives. As some of you may be aware, and as mentioned by our MC today, every year we celebrate the World Environmental Health Day on September 26, which was yesterday. with this year's theme being Global Environmental Health, Public Health, standing up to protect everyone's health each and every day. World Environmental Health Day is dedicated to create awareness about the impact of environmental health on our overall health and well-being. It is only timely that today we gather here with a shared purpose to foster awareness, collaboration, and action on one of the most pressing global challenges of our time. So with this, our theme today for our Environmental Health Forum will be a change maker, tackling antimicrobial resistance is our responsibility. As we stand at the forefront of the 21st century, we are confronted with unprecedented environmental threats that demand our immediate attention and collective responsibility. Among these threats, antimicrobial resistance looms as a formidable adversary. AMR poses a grave risk to public health, food security, and delicate balance of our ecosystem. The emergence of antibiotic-resistant pathogens fueled by misuse and overuse of antimicrobial agents call for decisive and united action. We must recognize that every individual, organization, and nations hold a crucial role in tackling this global crisis. It is our responsibility to become the change makers, to rise above complacency, and to drive meaningful and sustainable solutions. The theme for this year's forum embodies the very essence of what we must strive to be, a catalyst of change in the fight against antimicrobial resistance. Today, we come together not just as medical practitioners, researchers, and policymakers, but as advocates for the health of future generations. Our commitment to this cause goes beyond the walls of hospitals and clinics. It extends to our communities, our cities, and our global family. The threat of AMR demands urgent action, and it is only through collaborative efforts that we can address this challenge effectively. We must unite our knowledge, expertise, and resources to promote responsible antimicrobial use, infection prevention, and the development of new and innovative treatments. This is not a task for a selected few. It requires a collective effort involving every stakeholder in the healthcare ecosystem. Moreover, as we focus on tackling AMR, we must also recognize the interconnectedness of environmental health and human health, as use of antimicrobials are not only within the healthcare system. Our actions have profound impact on the ecosystems around us, and the health of the environment is inseparable from our own well-being. Sustainable practices, waste reduction, and responsible use of resources are vital components in our fight against AMR and ensuring a healthier planet for future generations. Today's forum serves as a platform for exchanging knowledge, best practices, and innovative ideas. It is an opportunity to learn from one another, inspire change, and foster collaborations that will drive tangible results. Let us engage in an open and constructive discussion, challenge prevailing norms, and embrace new perspectives. In closing, I want to express my deepest gratitude for everyone present here today. Your presence is a testament to your commitment to environmental health and your willingness to stand up as change makers. Together, we can build a world where responsible practices, compassion, and innovation prevail, ensuring a healthier, more sustainable future for all. Thank you, and let the Environmental Health Forum 2023 commence.
Thank you, Dr. Rafiza, for the enlightening speech. We would like you to remain on the stage to officiate our event today. We We would also like to invite all the heads of units, Dr. Rohaida Ismail and Dr. Nurul Izzah Ahmad, to join Dr. Rafiza on stage for the officiation.
Initiating launch sequence.
Thank you, Dr. Rafiza, for officiating EH Forum 2023. We now want to share with you a special montage of our center's work in environmental health research. Enjoy watching.
Ladies and gentlemen, now kindly join us in inviting our first speaker for today, Dr. Vineshwaran Muthu, for his talk titled One Health Approach, AMR National Action Plan. Please welcome Dr. Vineshwaran.
Selamat pagi, selamat sejahtera. Salam Malaysia Madani. Terima kasih kepada tuan dan puan majlis. Firstly, my talk will be in bahasa Inggeris lah. Walaupun forum-forum harus dilakukan dalam bahasa Melayu, tapi untuk tujuan saintifik kita akan buat dalam bahasa Inggeris. And terima kasih kepada EHRC and Dr. Rafiza Shaharuddin and also the whole team of EHRC for inviting Ministry of Health. Nampak? Okay. Memang it's a new socks. It's a new socks, tak ada bau. Well, where was I? Okay, socks. Now, thank you for inviting Zoonosis. And everybody will be thinking, why Zoonosis coming and talking about what you call AMR? So my talk today will be based on my experience, not rekecita daripada Dr. Vignesh. It's all based on scientific. Some are new, some are still people want to realize. Because what I like to share with our ladies and gentlemen, you all tahu scurvy tak? Test, 1, 2. Test. You all know scurvy? The scurvy thing was among the sea travel. This happened way back in during Alfonso de Albuquerque and so on. You all remember 1820, 24, 1511 sejarah. So sedikit mengenai sejarah. So what happened? They saw that the scurvy is a dangerous disease that time. So sekarang kita think AMR is a dangerous disease. Betul tak? But that time when you are in a ship, lelaki lah yang shipman tu. Right? We die of scurvy, and scurvy is very ngeri, you know. You punya tooth can fall down. All your gums will become like infected due to the bacteria that you commonly carry in your body, and you become also delirious and become like schizophrenia. So they think kamu dirasuk oleh hantu. Ya kan? But actually it is deficiency of vitamin C. That's why they call the British sea, crew, limey. Lime. So what happened? The research was done way back by, if I'm not mistaken, I forgot the name sorry. But when he did the first trial, double-blinded, how he did, he took 4 seamen, 2 gave them lime juice during the voyage, and then 2 no lime water or the orange. He saw during the trip, the 2 who received the lime water did not develop scurvy. That means all the symptoms and so on because of deficiency of vitamin C. But when the 2 that did not receive the lime juice developed the scurvy. So he came and told the scientists and all, scurvy is because of deficiency of vitamin C. Now, how long did the scientific people agree with him? You all know or not? Anybody know? I give you a ticket pulang balik jalan kaki Singapore. Anybody? How many years it took for the scientific industry to identify scurvy is because of vitamin C? How many years? 400 years. Okay? So that's why sometimes I open with this remark, because when there is something new, someone is talking from not the fraternity, we don't believe him or her. We don't keep our options open to ideas, thoughts, and so on, sometimes not from the scientific aspect, observational aspect. Because he observed the changes after giving the lime. That's why the British sea, armada became very strong because they gave lime juice to all the seamen, and whenever they go and fight Napoleon, they won the war. Because most of the Napoleon, the seamen were having scurvy. So that's why today we are going to talk about AMR, zoonosis, and also environment. Because every time we talk about any diseases and so on, the focus is human health. Okay, I forgot. Prof. Rosita is here. My very good friend, Dr. Rohaya, is here. And I think we should give both of them a clap because they are experts in their field. Because some of my talk is based on what their knowledge has given to me lah. That's why we need to recognize. So basically here, kita punya unit ni, you tengok ni ada apa? Wildlife and exotic. So a bit exotic lah my talk today. Exotic. And then the community AMR. Because you might wonder why the IPC people anybody didn't come. So usually yesterday I gave a talk in Taylor's University regarding the perspective of pandemic yesterday lah. So today's talk is One Health Approach National Action Plan. Now what I'm trying to emphasize here is be a mana dia? Hilang dia. Terkejut dia. Be a change maker. That means today after listening to our talks, you must be a change maker lah. So when I went to first year in medical school in Indonesia, they gave me a subject called kewiraan. The kewiraan textbook, when I open, they say pendidikan. What is pendidikan? Pendidikan, listen pendidikan adalah perubahan tingkah laku. Kalau today tak ada perubahan tingkah laku, I fail. I fail. That's why sponsor dah bayar I mahal-mahal. So I want you to listen to me today, not your phone. If you don't focus on me, you won't be a change maker. Because why? Tackling AMR is your responsibility, our responsibility. Because why? It's going to be very scary. It's going to be very scary. Because why? Monkeypox dah ada. Ya kan? Semua takut monkeypox. Ya kan? Right? So basically, zoonosis. Now, this picture we recently saw. COVID-19 kan? Tapi this is Spanish flu. Bukan Spanish fly Spanish flu. Ketawa sikit lah. You all boleh ketawa. Korang pagi-pagi stres betul macam ni. Tenang. Tenang. Bernafas. Semua bernafas ni? Okay. Alright. So, basically what happened, this one happened in 1918 where this influenza happened, dia misnomer. Spanish flu. Tapi kejadian dia bukan dekat Spain. Kejadian dia in America. Why? Movement of First World War graduates after coming back from war. So whenever there's war, there is a collapse of healthcare, environmental care, and then the public health is disrupted. That's why Ebola became an issue in Western Africa. Not in Congo. Congo biasa je. Tiap bulan kita ada Ebola. Tenang-tenang aja. Tapi dekat Western, why it became an epidemic and became such a fake, WHO said, PHEIC. Fake, right? Betul tak? Why they declared fake? Why? Anybody know? Tiket pulang balik Singapore? Jalan kaki. Tak. To use the funds of WHO, you have to declare. You tak boleh suka-suka. I nak pakai duit sikit. Boleh tak? Tak boleh kan? So you have to declare because why? The collapse of healthcare. Diorang perang saudara. Dia tak bom enemy, dia bom hospital. Dia tak bom enemy, dia bom jalan raya. Dia tak bom enemy, dia bom sekolah. So when there is a disruption of healthcare, you tend to get an epidemic or it becomes a fake lah. Ya kan? Because why? Negara miskin. Lepas tu fake. Lepas tu perang. Lepas tu ada Ebola. Macam mana dia nak bagi duit? So that's the reason why certain decisions are based on political and situational analysis. To what? To save the human lah. So the whole issue of AMR is to save who? Human being lah. Sebab I cannot cull you. Cull tahu tak? Ya? Sebab dalam industri, nanti Dr. Rohaya akan beritahu, jika ada highly pathogenic avian influenza dalam livestock, let's say dekat poultry, what will happen to the poultry? Besok tak ada KFC pun. Cuba you bayangkan, tak ada KFC satu hari. Tak ada McDonald ayam satu hari. Tak ada burger. Collapse oh. Collapse negara. Right? Because why? The French Revolution happened because of what? No bread to eat. Remember, no food, revolution can happen. Fine? So, basically, now why we are talking about environmental? Because all of us are staying in the environment. All of us, you think what? Dr. Vignesh duduk dekat rumah, tak keluar environment ke? Keluar kan? Now, all the contamination of water, everything we need. Ya kan? We need water. We need air. Ya kan? Anybody can live without air? Anybody here? Ada ke? Tak ada kan? So basically the environment is so important that you have to uphold the environment because of due to anthropogenic activity. Anthropogenic tu apa? Orang tanya kan? Manusia dong. Okay? Human. It's a joke also lah. Laugh a bit. Semua dah serius sangat. Okay? So kita nak santai hari ni So my presentation usually, because why? Medical, I see medical school semua, lecture semua memang boring minta ampun. That's why I selalu duduk belakang. Tapi hari ni duduk depan. Susah tau duduk depan. Okay? So we want you not to sleep. Those who sleep don't snore. Okay? Because I need to talk. So now we are talking about multifaceted ecosystem. Multi, sebab kita ada banyak. And then later we want to talk about the interdependence of humans, animals and environment health. Because all the time we speak about animal health, satu komponen, human health, satu komponen, and then the environment, satu komponen. Kita tak nak merge together. Sebab apa? Sebab apa? Because masing-masing ministry lain. Ya kan? Department lain. Tak pernah jumpa. Jumpa pun melalui surat. Dia melalui surat and then mesyuarat. Mesyuarat semua datang tension. Ini apa nak cakap, bos nak cakap apa, bos nak marah apa tu. Ya kan? Tapi sebenarnya kita kena kerjasama lah. Sebab kita kalau tak kerjasama, macam mana lah Dr. Vignesh nak hidup kan? Habis mati sebab AMR. Betul? Mati sebab AMR. So basically, you see, when they gave me this topic, it's a very big topic, and then given me 45 minutes. Actually, this topic I need to talk 1 day, 2 days, 1 malam. Tapi kita compress lah, kita compress. So basically, what is it? Kalau I terus cakap tentang AMR, nanti ada yang tak tahu cerita. Ini macam sinetron lah, episod 1, episod 2, episod 3 kan. Let's say you masuk episod 7, dia tengah bergaduh, tapi you tak tahu episod 1, 2, 3. Ya kan? So sekarang ni, I akan compress dia jadi satu yang betul. Then after that, Dr. Rohaya dengan Prof. Rosita akan menerangkan lebih in detail. Sebab kita starting ni tu susah sikit. Last time I used to play cricket for school. Victorian. Right? Victorian cricket kalau you main first opener tension. Right? Macam tu. So basically what we're going to talk about, infectious disease. Now, how does infectious disease happen? Why certain infection happens in human? Why certain infection happens in animal? Why certain, ada orang tanya waktu I cakap tentang rabies tu kan, biawak kan, kalau boleh kena rabies tak? Ya kan? Sebab dia tanya, I tanya kenapa biawak kena ada rabies? Sebab dia makan anjing yang mati. So this question was asked to me where in Syrian waktu rabies outbreak in Syrian lah. And then we're going to talk a little bit about zoonosis, and then we'll talk about resistant bacteria. Because the bacteria has overlived us. Bacteria has been there for million years. Boleh tak you cakap, kenapa you resistant? Boleh ke? Boleh ke? Siapa yang menyebabkan resistant? Manusia. Sebab penggunaan antibiotik yang kita tak faham. Ya kan? Kadang-kadang kita tak faham, kita pakai. Sebab apa? Kadang-kadang we couldn't diagnose whether it is bacterial ke viral. Satu. When I was in the klinik Taman Ihsan, I think one of my bosses here lah, Dr. Shima dulu, I kenal, di Pejabat Kesihatan Daerah Gombak, before I came to the force lah. That was, doktor tak bagi antibiotik ke? Patient tanya. Tak adalah, ini bakteria lah. Ini bukan bakteria, viral. Ini doktor ni tak pandai. Ada tak? Dia say like that because the human, dia punya perception antibiotik tu bagus. Dia akan bunuh, dia kuatkan badan kita. Dia akan bunuh semua organisma. Right? But now, it's not their fault. My fault. My fault. Because dulu Dr. Roslan told me, Dr. Roslan Isyad told me, kalau public tak faham, salah you. Bukan salah public. Right? So we must tell in the sense that they understand. Bukan you understand. You memang dah understand. Kalau you cakap medical dengan diorang, dia tak faham. Ya kan? Sebab level atau pendidikan tu berbeza dari satu orang ke orang yang lain. Dan perkataan yang sama, penggambaran dia lain. You understand or not? Same word, the understanding is different. Right? Okay. So first we're going to talk about. I'm also in the invasive alien species. Ya kan? Bila I cakap invasive alien species, kau alien ke? I cakap memang I alien lah. Right? Okay. So basically, this is the biosphere that we need to know. And where are we? We are in Malaysia. Betul tak? Betul tak Malaysia? And then Malaysia dikelilingi semua the mammal richness. Because why? Kita hari tu ada COVID kan? COVID-19 kan? And then kita tanya, kenapa dekat haiwan dah ada COVID-19? What we must understand, kita medical ni tak boleh lah bingung. Masyarakat bingung tak apa. Jangan kita yang bingung. You tak boleh jual ubat. You understand or not? Kalau tak tahu, tanya kita. Kita semua tahu. Tahu sikit lah tentang medical. So kalau kita yang tak faham, bila masyarakat datang tanya kita, kita lagi buat dia tak faham. Ya kan? Betul tak? So that's why we need to understand, we are staying in this diaspora. That means the environment lah. And then bila COVID-19 happen, you see when there is a virus that has high plasticity. What do you mean plasticity? It can infect different types of organism or species and so on. That's why the jump of host happens. Right? The host changes, the virus adapts to the human host and establish humans to human transmission. That one another day we'll talk about it. And then this diaspora is why we are in the environment scenario. We need to understand this, that we are living in this environment where we have pre-domestic. Siapa ada haiwan dekat rumah? Kucing, anjing and so on. Kucing datang cium you cium dia, right? Ada kan? You pernah ingat tak dalam mulut dia ada bakteri apa? Pernah buat swab? Kita yang swab kan? Swab hidung, swab mulut, swab tekak, swab ketiak, swab semua kita. Tapi kita ada tak swab dia? Bila kita keluar daripada rumah, dia pun keluar juga. Dia nak kerja lah. Ada yang tinggal rumah, ada yang keluar. Yang keluar tu ada pergi mana-mana tak? Kita tak tahu kan? Bila dia balik, dia mandi. Tak environment. You all are doing environment, you should know what is there in the environment lah. So dia balik, you cium dia cium you, dia cuddle dia, you tidur dengan dia. Right? Bila you kena jenis-jenis penyakit dia, kenapa I sakit? Right? That is why we must understand this one. And then kita ada emerging, new emerging and deliberately emerging. All this we know, ini to put a fear lah. Ya kan? Tapi this is what is happening. And it is there so that Dr. Vignesh is still employed lah. Okay, so and then kita ada global health, what they call epidemics, and then we had this pandemics and so on. Now, somebody asked me yesterday, so one of the question, dia tanya in the next 5 years boleh ke ada pandemic, ada ke apa? Now, the plan of human health is we must be prepared for anything. Betul tak? Kita ni macam prajurit tau. In the health sector. Kita bukan tentera yang lawan musuh manusia. Kita lawan musuh kita tak tahu. Bunian. You see what happened when I had a patient came to me, uncle, pakcik lah came and told me, pawang sebut dengan saya, I kena jangkitan bunian. Patient ni, ini kisah benar kisah benar. Bukan kisah, happened to me. I told the uncle, you know, as a doctor, what we should say? Bukanlah, you know. I said what, you know, betul pakcik. Memang bunian, tapi I boleh nampak. I pakai mikroskop boleh nampak dia. And kita dapati bahawa itu adalah TB. Dan TB itu boleh ubati, pakcik. We gave him treatment. 6 months sembuh. Lepas tu setiap kali ada musim buah, dapat buah. Siapa? Dr. Vignesh. Durian dapat, rambutan dapat and so on. So, that's the thing. We must talk in their language. Kalau I cakap, bukan, bunian, bukan, that means I'm creating what they understand is different. Why? You don't need to be 100% perfect all the time. Don't be perfect. Be yourself and put yourself in their shoes. That's why we develop empathy. Doctors must have empathy so that we can think and behave in the human aspect. Susah lah veterinarian nak jadi empathies to their client. Ya kan? I tell you, to be a doctor is much easier than being a veterinarian. I rasa satu hari I tak boleh tahan. Sebab apa? Kita punya klien macam-macam spesies, you know, bukan satu spesies. And then bahasa dia orang tak faham. Boleh ke? Dr. Vignesh tak tahan lah. So, veterinarians, I tell you, kalau diorang tak ada, kita tak ada ayam yang sihat tau. Ingat Okay. So, basically this is what. Now, why I want to highlight this before we go into AMR and so on. Kita ada something that is called event 1, 2, 3, 4, 5, 6 and then throughout this history lah. Why I want to highlight is Malaysia. Sebab kita ada anybody can fly. Everybody can fly, anybody can fly. Because tak. Sebab Dr. Vignesh hari tu ada dekat KL pagi. Tengah hari dia dekat Bangkok. Makan tengah hari. Ya tak? Lepas tu dia pergi somewhere else lah. Okay? So basically when I incubate a disease, a pathogen, let's say that pathogen is something novel. Nobody knows. Kita dekat hospital bila kita sakit, dia semua penyakit berjangkit tu mula dengan ALI. Waktu ALI tu kita ingat apa? Dengue lah, rabies lah, typhoid lah, lepto lah and so on. But the diagnosis diconfirm dengan if they go to the beyond. Because leptospirosis, they settle kan. First, dia clinical, demam, this one. After that, it goes to the Weil's disease and so on. That is why, this is pathognomonic for leptospirosis. But that's too late. Ya kan? But during the initial phase, the lab diagnosis is very important for us to diagnose what we want to give. Because why? We want to give the correct antibiotic. Ya kan? That is one of the hiccups that we have. When you don't give the correct antibiotic, you put an empirical antibiotic into it, what happen? It's a broad spectrum. And then, biasalah manusia kan, bila simptom dah okey, tak makan ubat. Betul tak? 2 hari, 3 hari makan ubat, hari ke-4, 5, 6, tak makan. Bagi pada anak. I got patient. Patient datang bapa bawa anak cakap bapa ada bagi antibiotik. I cakap bapa you doktor ke? Tak. Bapa keluarkan daripada hari tu punya. So that is a practice that we have to change. Why? Antibiotic is not macam Panadol. Ya kan? Sebab Panadol cakap apa? Okay, do we see advertisement yang cakap antibiotik amoxicillin baik untuk kesihatan? Tak ada kan? Kita lihat Panadol je kan? So they reinfer all the medicine is like Panadol. Makan bila perlu, lepas tu berhenti bila tak ada symptom, which is wrong. So basically we have all these events and Malaysia is highlighted zoonotic event. Now, kita ni sponsor kita zoonotic lah hari ni Okay? So kita dapati bahawa kita ada wild, both non-wild and unknown. Right? So we have wild, we have unknown. So 3 weeks ago in Melaka, I gave a talk to the wildlife veterinarian. Baru I kenal ada wildlife veterinarian, ada livestock and ada veterinarian. So wildlife veterinarian, they don't campur normal veterinarian. So they had a what do you call a conference like this. I give a talk on some of these lah. So kita ada wildlife, kita ada non-wildlife, kita ada both. Tapi nampak tak ni? Kita ada drug resistance. So this is what, kalau you faham ni, you dah change dah. Kalau masih belum change lagi, I kena teruskan lah. Kalau tidak, I tutup kedai. Tak ada, joking. Okay, so we have something that is drug resistance. Where? This part of the world lah. Alright, so now infectious disease, kita ada human to human transmission. That means established human to human transmission. Some are stage 1. That means from rabies came to human to human tak ada. Right? And then COVID-19 came to human, became human to human, tapi dia tak 100% sustain. Dia masih kita boleh kurangkan. Tapi one of the greatest change that we saw is HIV lah. HIV is from SIV, simian immunodeficiency virus. Right? It transformed to the human immunodeficiency virus because why? The practices that we do. Kita makan, the people who had the first HIV develop are those who ate the bushmeat, the wildlife meat and so on. So we must understand there are ways of viruses, bacteria and so on transfer, what do you call, jump host from one host to another based on how they contact. For example, baru-baru ni kita ada tularemia. Now, tularemia ni macam hebat juga. The way it's not like dengue, no. Dia vektor je. Dia ada vektor, dia ada aerosol, dia ada contact and so on. So, multiple way of contacting to human beings. So, we need to identify what are the characteristics of the agents before we deal with it. Right? Okay? So, kita ada, so in the environment, we have millions of viruses, bacteria that has not jumped to the human. That is why today, tadi kita punya Dr. Rafiza said, we need to peka kepada environment. Because why? Apa-apa kita keluar, masuk environment. Apa-apa kita cuci, masuk environment. Ya kan? Apa-apa kita masuk, keluarkan environment. Right? Apa-apa antibiotik ke, estrogen ke, apa ke kita makan, masuk ke dalam sumber air. Dan sumber air ini akan pergi ke livestock. Akan pergi ke haiwan-haiwan, kucing ke, anjing ke, and so on. And then akan pergi ke pertanian. Petani akan menggunakan manure haiwan atau human ke and so on ke dalam dia punya dia punya whatever environment that they do. So that's why it's very important for you to understand is as a whole, not as one. Alright, and then daripada situ kan kita dapati bahawa wildlife ada, livestock and so on. So that's why today we have experts from veterinary department and also experts from the environment, Prof. Rosita, to talk to us about this. And then this is the scenario. Sekarang Dr. Vignesh dekat sini kan, kapal terbang, sea and so on. Why? Transporting humans, transporting livestock for consumption. Right? So that's why we must understand that. And then any outbreak ke, AMR ke and so on, it will lead to bukan hanya penyakit, tapi untuk kawal penyakit, untuk prevent penyakit atau untuk control the penyakit, you need money. No money, no talk. Ya kan? So when you have development money, but you have a pandemic, you have to tap your development money and use for pandemic. Because why? We don't want the humans to die. Many lah. Kita tak nak, kita propose lah. Ini tak berapa nampak lah. Okay? Can you off this one? So what happened when Alexander, now we go to the AMR. Alexander Fleming, Sir Alexander Fleming, bila dia discover and resistant. So, you see, the discovery of antibiotic, you tahu tak macam mana? Accidental. Accidental. You know why? Bila Petri tu buka, dia makan roti. Roti crumbs fell on the Petri. And the roti crumb grew the penicillin and killed the organisms around the breadcrumb. That's how he found. So all your researchers, I'm not a researcher, I'm just a technical officer, all your researchers are in a very good position to come accidentally find something new and share it. Because why? It will develop a sense of kita boleh tackle this AMR and so on and so on. And then what I like to say is, you see, another thing is soil. 7 classes of antibiotic was found in the soil. Virgin soil, not the human developed soil. Okay? So that's why if you are taking soil and so on, I think this one everybody knows. How the bacteria develops resistance. Because you see baru 11 minit. Okay. Alright, so dia ada pencatat dekat bawah pun. So I pun nak record lah. Baru 11. Kita ada 45 minit. Cerita kita 45 minit. Okay. So basically, how the bacteria develop resistance is based on how the drug works on the antibiotic. On the bacteria. Now today, we just going to talk about bacteria. Right? Memang ada antifungal, antiviral, and anti so on lah. Tapi kita hanya akan highlightkan sedikit mengenai antibiotic resistance lah. Walaupun kita akan bincang semua later on. Tapi dalam konteks ni, you see when you are exposed to certain kind of bacteria, you develop the clinical symptoms. Now when you develop clinical symptoms only you come to doctor. Ya kan? Bila you dah teruk, baru you datang jumpa doktor. Betul lah? Bukan waktu kita subclinical. Now, subclinical kita ada. Sebab kita tengok spectrum of diseases, they have a spectrum of asymptomatic, towards symptomatic, towards severe illness, towards death. Fine? Okay. So, what happens when you are infected? Either you develop immunity and then you 100% sembuh. Atau you partially sembuh. But when you partially sembuh, you must see whether you have disability or not. When you are partially sembuh and become chronic, what happens? Cepat ni 5 minit dah keluar. Okay. So when you are partially improved, but you have disability. Now what happen is like this. Kita ada tengok kan COVID-19 kan? 19 kan? Now, lepas tu kita tengok, kenapa COVID-19 ada neurological symptoms and so on. Now, if you look at the veterinarian studies on coronaviruses, they have a host, if I'm not mistaken, mouse, some kind of animal, where they develop chronic neurological sequelae due to coronavirus. That means coronavirus yang sekarang ni, yang kena human tu, dengan adik dia. Bukan adik dia, abang dia. Dengan abang dia infect one host and develop neurological condition. That is the demyelinating disease of the nerve. That means kita ada nerve, kita ada wayar kan, wayar. When I worked in Kelantan, first day dia cakap masuk wayar. Masuk wayar dalam ni. Actually it's endoscopy lah. Okay, so when you take the wire, you got the copper inside and then the plastic outside kan. Dalam nerve pun sama juga. Dia ada nerve dalam, copper, and then dia ada macam plastik. Schwann's, selaput. What happens is that the immunological reaction happens not at the nerve, but at the pembalut dia. So bila you ada kabel elektrik, bila dia punya pembalut dia pecah, apa jadi? You ada current kan? Current itu yang menyebabkan symptoms neurological. Kalau dekat otak, masalah otak lah. Ya kan? Tengok dekat mana. If dia dekat center you bercakap, auditorium. Audi. Kalau dekat visual. Kalau dekat motorik. Kalau dekat sensorik. Right, so you have to understand it as a whole. So, who knew it? Orang veterinar, they know it earlier. Now, we just have to infer to the human situation. Right, that's what I learned a lot from the veterinarian. Because I read a lot of animal diseases, now wildlife diseases. Sekejap lagi orang tanya, you doktor veterina ke? I cakap betul. Betul, I cakap. Sebab, why you want to explain? Bukan, I medical doctor, so. You don't need to be 100% correct all the time. Alright? Okay? Now, this is how the develop happens. You can read lah all this, Dia akan masuk dalam sel, dia melalui sel, dia akan menghambat synthesis and so on. So, dia ada classes of antibiotic, how they work and so on. And we also have now, this is what interests me. Because we already know the bacteria can change based on the stress. Apa stress kita bagi? That means the antibiotic stress, it changes. Why? There's something called gene. And usually kita belajar tentang the pathogen. Kita tak belajar dia punya environment. Microbiota. Ya tak? Macam mana gene tu, you all kalau ada makanan sedap, you share with your friend, right? Correct or not? Ada yang tak ada macam ni. Makan sendiri. Jangan Kalau you ada apa-apa sedap, you bagi kawan. Sama juga. Microbiota tu is where the genes transfer from one microbe to another microbe. One microbe will be non-pathogen to the human, but it's in the environment. That's why we have the Enterobacteriaceae. Enterobacteriaceae mana? In your gut. Dalam gut kita ada apa? The microbiota of the gut. So when they are in their environment, they share genetics. You need to find at that level and kill them there. This is the future. Don't take 400 years, Don't take 400 years, Vitamin C. Vigneshwaran won't be around. Okay, now already 50 above. Fine? Look into it. Look into the microbiota. Why? Because we know already the fella can change. Ya kan? Hari ini kita pakai coat. Semalam I pakai t-shirt. Macam tu kan? Dia boleh tukar. Tapi apa yang menyebabkan dia tukar? Ada H&M. Betul tak? Ada Uniqlo and so on. So Dr. Vigneshwaran pergi sana beli baju lain. Pergi sini beli baju lain. Baju tu yang kita kena tahu. Dari mana dia dapat? Sebab kita dah cuba dah. No class. Ya kan? Semua saintis cakap no more. No more class of antibiotics in the arsenal or in the labs. Now we need to think beyond it. Because why? Dr. Vigneshwaran doesn't want antimicrobial kena pada I. Ya tak? Right? That's why we talk about the prevention and so on. So this is the potential routes of transmission of antibiotic resistance that happens in the country locally. It can happen districtly, it can happen regionally, and it can happen globally. Why? One is the water. Then you harbor the gene or the bacteria does not give you clinical symptoms. What you do, you travel. When you travel, you had symptoms. You pass over to your friend beside you because why? We talk lah. Dalam aeroplane siapa naik kapal terbang 2 jam 3 jam macam ni? Tutup semua. Ada ke? Ada ke? Tak ada kan? You dari mana? Kalau apa lagi kalau Dr. Vignesh sebelah yang cantik-cantik lah. Ya kan? Kalau yang tak cantik, tak apalah. Tak payah. Tinggal luar. Tak ada macam tu. Dr. Vignesh always friendly lah. Friendly. Kita friendly kan? Kita social animal sebab kita boleh bercakap. Ya kan? Kalau tak boleh bercakap, tak boleh lah. Susah. Macam tu. Okay? So we have this spread of antimicrobial resistance and it spreads not only locally, it happens throughoutly. Because the water, Indah Water kan? Indah Water. Siapa tak bayar Indah Water 6 bulan? Balik ni bayar. Sebab Indah Water ada sponsor air juga. Tak adalah, just joking. Because Indah Water plays a very important role in treating this treating this water so that the water goes back into the environment. Right? Go to environment and then go back to Earth. Ya tak? Ada ke air daripada angkasa lepas datang masuk? Ada ke? Ada ke? Daripada Marek, daripada moon dia air tiba-tiba masuk. Tak ada kan? We have to manage what we have. Right? Okay? So this is why the practices, siapa lepas ni bila nak makan cuci tangan? Nanti saya tengok tau, siapa tak cuci tangan, saya dah taruh dekat situ, bayar RM10. Sebab apa? Nanti you kena antibiotik, antimicrobial resistant, kena E. coli. Just now I talk for you about Enterobacteria. Dia senang je keep. Klebsiella, E. coli, Enterobacter dengan Proteus. Itulah kita punya kawan yang sekarang dah jadi resistant. Sebab apa? Kita bantai dia, kita nak ni. Because if it's there at its environment, it's not a pathogen. But when it's changed the environment, that means dia masuk ke darah. Dia masuk ke tempat lain, dia masuk ke organ lain. So dia menjadi jangkitan. Dan jangkitan itu, 5 minit. Baru 20 minit. Lagi ada 15 minit. Okay, ini sengaja I nak ni. Okay, so basically this is it. And then this is how the thing spreads and so on lah. And then if you look at this, we have this antibiotic resistant rates. And then kita ada antibiotic consumption. I want you to focus here in Malaysia. We consume also banyak, kita resistant pun banyak. This paper ada you baca nantilah. This global resistant drivers lah. Kita nak tengok apa driver-driver dia. And then ini adalah carbapenem dan cephalosporin. Kita ada critical pathogen antibiotic resistant rates. And then we are Malaysia, we are here and we are dikelilingi dengan negara-negara yang telah melaporkan critical pathogen antibiotic resistant. Sebab dekat everybody come into Malaysia. Right, kita ada immigrants kan yang kerja dekat Malaysia and so on. So all that are the sources of where we can get these antibiotic resistant organisms here in Malaysia. And then we look at the magnitude and impact. Kita ada magnitude. Sekarang kita ni developed country ke, developing ke, apa and so on. Sebab no correct. Tapi tambahan, bro, macam ni. Can I talk till 10:15? Boleh Boleh. Because after that only kan? Okay, soon. Sebab I started earlier, thank you. Because I got a lot of things to share with you. But this is, I got another slide. Okay? So this is why, this is one. And then the drivers. Apa kita perlu faham hari ini adalah driver. Bila kita tengok driver tu ada dekat situ, ada kemungkinan. There is the possibilities of antibiotic resistance and so on happens at that point of time. So what are the drivers? Now, it can be changes in food consumption. Increased population. Today, because of everybody eats chicken. Last time when my father was in the army, my father was in the Air Force of Malaysia, we only eat chicken once a week. Today we eat chicken every day. 3 times a day. Ya kan? Dulu waktu kenduri, waktu hari raya ke apa ke, kita sukalah sebab ada ayam. Kalau tidak hari lain, ikan, sayur, tahu and so on. Right? Right. Lain lah sekarang kan. Sekarang punya generasi semua tiap hari makan ayam. Tak ada ayam, habis. Habis hari tu dekat UK, no chicken. Merusuh. Okay? Because why? No chicken. So, that's why another thing, spread of resistance through international trade, travel, global problems of sanitation, water contamination, sewage, manure runoff and waste. All these are industries. Because you see, what I'm trying to say here is the gene also travel. Not only the bacteria. The gene travels itself. You see, when you see the gene, you see MCR1 was initially in the pigs in 2014. Subsequently spread to 50 countries. So now, right? Who traveled? Who brought the thing? Yeah, kan? This is not the bacteria, this is the gene. Fine, okay? Now we are going into the microbial ke apa tak. Okay. New Delhi beta-lactamase originally in India. Now if you see China in India, population very high. Ya kan? You tengok ada orang kaya, ada miskin, ada yang super miskin tinggal di satu keliling yang pertama. The first thing collapse is the environment lah. Sebab apa? Air, orang berak dekat jalan, orang kencing dekat tepi and so on. Tapi that environment is being what they call exploit. Because when you see when Wuhan virus happened in Wuhan, they test the animal, tak ada. But they test the environment, ada. Fine? So, today what I'm trying to say is, my perdebatan hari ni, environment kita kena jaga. Kalau kita tak jaga rumah kita, siapa nak jaga halaman rumah kita? MPAJ ke? PBT? You think about it. Jangan hanya jaga dalam rumah. Luar rumah tu penting. Tengok air kita ke mana. Indah Water bayar. has been detected in UK and then in Bangladesh and so on. So drivers, inilah drivers dia, you baca. And then kita ada strategi kita. I'm going to talk to the next this one. Finish, go to my next one. 10 minutes. Bro, open the next this one. So sebenarnya kan, antibiotic action plan. Ada kan? My topic is AMR and then antibiotic action plan. Now, slide ni is from Dr. Feroza. Dr. Feroza told me this one belum bercakap dekat apa ni? Belum official 100%. Tapi you all dapat panas-panas. Ya kan? You all suka kari panas kan? Ya kan? Okay. So basically what I'm going to share, don't take pictures, you just listen. No pictures please, no recording please, because why? This has not been endorsed and given out. But what I want to share, okay. Dalam slide ni is from Dr. Feroza lah. Tadi tu slide saya lah. Ya kan? So in Malaysia, now we're going to talk about scenario in Malaysia. Scenario in Malaysia, what are we doing to curb this, to slow down? Sometimes you cannot 100% eliminate. You kan? You tak boleh eliminate, you tak boleh eradicate, tapi you nak slow down. You nak memperpanjangkan efek tu supaya perlahan-lahan lah jadi. Jangan terus jadi. Betul? Okay. So kita ada National Antimicrobial Resistance Committee. First thing, kita ada komiti. Right? Malaysia dah ada. Jangan cakap Malaysia tak ada. Malaysia ada komiti. Dan dalam komiti ini, ini dia punya Dr. Feroza. I don't want you to record. No recording please. No pictures. Okay? Now, overview. Kita ada, you see when you present a presentation, you ada banyak kata-kata dekat situ, you ambil kata yang penting, you highlight. Okay? So I want you to highlight 2017 key stakeholder, co-chair by DG Health and Veterina, ada 4 TWG, National Infection and Antibiotic Control Committee. Ini kita ada. Jangan baca yang lain. 2017, kita ada key stakeholder, kita ada co-chair. That means kita co-chair dengan veterina. One Health. Ya kan? Hari ini kita cerita tentang One Health kan? Itulah dia. So kita ada juga National Infection and Antibiotic Control Committee. And then NARC, that is the NARC, reports the progress of the implementation of National Action Plan, including challenges identified and actions taken to address. So this document will be published. Siapa-siapa yang interested boleh baca. Right? Dr. Vignesh is not going to tell everything in detail. Later I'll tell you. Okay? And then inilah TWG. I bagi you 1 minit je tengok. Lepas tu kita tukar. So inilah banyak a lot of key stake. Ramai orang dekat situ. Right? Ada hari tu Dr. Vignesh dekat situ, sekarang macam tak tahu ada lagi ke. Mungkin when my boss came, she took over lah. Itu yang bagus. Bila ada boss ambil alih. Kita relax dulu. Okay? Alright. Okay? So kita ada ni dekat sini. That day I was here lah. Surveillance and research kan ni. Ini. Somewhere here. Okay? So kita ada priority area 1, 2, 3, 4. Priority area dia awareness and education. What's happening today is education awareness. Sebab some of us already learn, some of us are not known and so on. So what we are doing today is memang berdasarkan National Action Plan. Fine? Why? We want to create awareness, education. This one is research is done by EHRC and so on. And then infection prevention control and then the appropriate use of antibiotics. And so on. Ini ada banyak lah NGO ke semua ada dalam tu. Jangan cakap tak ada. Right? Lepas ni kalau orang tanya NCRA, semua orang dah tanya. Dah yang hadir dekat sini Ya, Guru Setia dah tahu semua orang yang datang tu tadi dah AI kan. Ambil AI dia punya ni kan. Kita tahu siapa yang tengok, siapa yang tak tengok. And then kita ada background All this kita ada because next month if I'm not mistaken is the launching and also the Minggu AMR and so on. Fine? And then we have the key components. Now, key components is political awareness commitment. Apa-apa pun dalam public health, you nak duit, you kena parti politik. Kena cakap who's the boss in the house. currently, you have to convince them, you kena jual you punya agenda. So how? There's two ways of changing humans. Two ways. Put a fear, put a need. Dr. Vignesh woke up, came here because why? He has to pay the car loan. Fear. Need. Dr. Vignesh wanted to talk to you all. I came. Either you put a fear or put a this one. You know, kotak rokok, bila kita taruh sana gambar yang orang sakit, ini, yang ni semua, the sale went down. But after that, the sale went back. I don't know. No, the sale went down. Then went back. I don't know. Okay, you all have to think. Research. Okay, so kita ada multi-sectoral coordination between national and local. So when you do national policy, jangan shock sendiri. Orang local tengah, so many plan ah. Because when I was in the clinic, my MA chief ada 23 return tiap hari kena isi. Korang nak bunuh dia ke? Fikirlah, apa-apa return yang tak perlu, you revisit. Jangan start aja tapi tak ada yang end. You start shock sendiri tapi tak ada yang end. Okay, think about it. When you go back, you think about it. Okay, and then kita ada data. And then the guy died of heart attack. The guy, my age, you know, if he's alive today, he's my age. He died. Because why? So many returns, have to run the clinic, have to see the PPP and so on. You kill the bloody man because of all these returns and so on. I just don't know why. Okay, so finally, this is what? This is my final slide, right? I tahu memang banyak. Sebelum ni, bila I terima, tak ada yang merah, kuning, hijau semua, tu tak ada. Dia hitam semua. Tapi again, if you are presenting to an audience that haven't seen it first, highlight lah sikit. I bangun tadi 4 pagi. Betul. Semalam prepare one, today I prepare. I don't prepare 1 week. I don't use other people's slide for my first slide. I never use. It's today punya. Every talk, my talk is different. That's why when Vigneswaran talk, come and listen. Okay, so okay, so kita ada awareness, surveillance, reduce infection, and then this one my slide. The last slide, okay. Okay, so kita ada increase awareness. Today is One Health. You get it now? No need to say anything. We have One Health. We have microbiologists, we have public health physician, we have environmental, kita ada KPPKP, kita ada nurses, kita ada veterina doktor, kita ada professor, kita ada university, kita ada masyarakat ada. Masyarakat umum? Anybody? Kalau ada tadi, I bagi hadiah. Tak ada. I tak bawa hadiah. Actually, I wanted to bring hadiah, but I didn't know lah. I forgot. Okay, so kita ada strengthen educational. Again, it's awareness. It's education. So if I come and give you a generic thing, this is my generic. I datang, talk to you about National Action Plan. Do you know the story? Why we want to do this? That's why whenever I give rabies vaccine for Perilitan, ada tak siapa-siapa? All the ranges in Perilitan, no Vigneswaran Muthu. Because why? I gave the talk on rabies. I told them why you need the vaccine. Bukan macam COVID-19. Bagi dia vaksin. Lepas tu orang tak tahu. Orang sakit jantung tiap hari ada. Orang kena stroke tiap hari ada. You kena faham tak? Orang kena infection setiap hari ada. Jangan you based on COVID-19 punya vaksin, you cakap saya sakit jantung, sakit stroke. Okay, because when there was no COVID-19, orang ada mati juga. Orang 36 tahun pun mati sakit jantung. You faham tak? Kita orang kesihatan lah. Jangan kita pula cakap, betul lah vaksin. Sebab vaksin lah Dr. Vignesh jadi macam ni. You get it or not? I still hear from medical staff lah. Don't be so... Okay lah, I don't want to say the other word. Okay? Alright? Don't be a songkut. Okay. Alright, okay. So kita medical staff kena strong lah. Kalau kita tak strong, macam mana jual ubat? Dulu waktu saya tahun 80-an dekat BI, saya kena jalan sampai Coket kadang-kadang. Tak ada duit. Bas 17. Siapa dengar? Bas mini 17. 35 sen. Lepas tu jadi 50 sen. Dekat Coket orang jual ubat. Okay, we're going to finish that. One more minute. Okay. Alright. So finally this one. So when you want to sell your medicine, you must create some curiosity and something that they understand all this. Okay, so strengthen medical, NGO, government, promotional activities, access knowledge, use of amongst public health, veterinary personnel, livestock and so on. And then kita ada strengthen surveillance, strengthen One Health, and then participation at regional, sharing information, strengthen capacity of the laboratory, and then so that they understand the susceptibility of the antibacterial, and then develop collaboration among all the labs that we have, and then reduce infection, implement prevention, strengthen water sanitation and hygiene, cuci tangan. My family sebelum makan cuci tangan, keluar toilet cuci tangan. Sebab apa? Tak nak susahkan saya. Kalau anak saya sakit, saya lah yang kena bawa hospital. Betul tak? Bila seorang pesakit sakit, bukan pesakit sakit, keluarga dia sakit. Ingat tu Ingat tu. Jangan kita lupa. Alright? So, bila keluarga sakit, you see, when I was in the hospital, everybody will come and ask, bapak saya macam mana? Apa keadaan bapak I? And so on. Kita dah lah pesakit dekat situ. Lepas tu family tunggu. Right? Patient, bapak dia lah, okay, stable. Tapi dekat sana, nurse panggil, doktor, patient, gasping. Betul tak? I don't know why, malam baru dia call. Tengah hari all okay, happy, malam dia, kita, aduh. Alright, that happens in my experience. I tak reka tau, I buat. Dekat husband satu, ward 5, mati. Bukan mati berdiri. Okay, alright. So strengthen the IPC wash and then enhance good food hygiene. Okay, good food hygiene. Don't mix your raw with the cook. Don't leave your cook outside. Because why? Last time my mother did lah, my wife. Okay, who teach you all how to cook? Your mom. Your mom went to IPC course. Just joking. Go to the Hell's Kitchen. Okay? Kalau you all nak pandai how the food hygiene and so on, go and see for Hell Kitchen and then practice enhance good food hygiene. I tengok kalau sekarang ni kita tengok tak, kita banyak ada food handler dekat jalan raya. You ada tanya tak dia cuci tangan tak? Dia pergi toilet macam mana? Dia cuci tak lepas keluar toilet? You tanya tak? Tapi sedap lah nasi pisang goreng, sedap. Okay, last. Okay? Alright, dah habis dah. And then this one, implement, practice, support national. Now I want you all to support the environment, the veterinarian, the universities and so on, their effort. Jangan you jadi, tak apalah, I buang aje lah sampah dekat situ and so on. Okay? And then strength biosecurity, ensure activities and distribution. This is more onto the pharmaceutical and so on, develop policies and initiatives and so on. Strengthen laboratory. So, time's up. I would like to thank, this is my last slide, well, even though there's a few more slides. Highlight, okay, tapi ini Dr. Feroza punya, not mine. Okay, so thank you so much. See you all next time in next event. Thank you. Sebenarnya my time 38 minit. Oh. I tak marah.
Okay. Ladies and gentlemen, let's once again give a round of applause to Dr. Vanishwaran for his insightful talk. Ladies and gentlemen, today we are honored to have with us a remarkable individual whose contribution to the field of public health have been nothing short of extraordinary. Professor Dr. Rosita Hood, a professor in environmental health and the head of the Department of Public Health Medicine, Universiti Kebangsaan Malaysia. Professor Dr. Rosita has made significant contribution in her role as a consultant for the United Nations University and WHO Neglectable Tropical Diseases Program. She's also a project leader for the Malaysian One Health University Network on zoonotic diseases and a core member of the National Environmental Health Action Plan (NEHAP) under the Ministry of Health Malaysia. Her commitment to advancing public health is recognized locally and internationally. Today, we are privileged to have Professor Dr. Rosita with us, and she will be delivering a talk titled AMR in Environmental Perspective, Key Players, Driving Emergence and AMR Spread. Please welcome Professor Dr. Rosita Hood.
Kat ni
Lagi ke slide yang
right
first.
saja, yang pointer. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. First of all, thank you, Mr. MC for Mr. and Miss MC for your kind introduction, and I would like to thank Dr. Rafiza Sharuddin and her team from EHRC and IMR for inviting me today. And resistance in environmental perspectives, key players driving environmental emergence and the AMR spread. So I can I so see. Sorry about that. Okay, because if like this nanti my neck apa strain kan. If I can see here also. So antimicrobial resistance is one of the top 10 threats in global health, as highlighted by Dr. Witness earlier. And this fact is rather worrying because it is on the increasing trend. Okay, kita ni sekejap ya, technical. So I think while waiting, I can just explain from my slide. So misuse and overuse of antibiotics in human health, food animal production and agricultural, as well as we see those residual in the environmental, such as pollution and poor waste management, contributes to the rising problem. So AMR depends greatly on the interaction between the humans, animal and as well as the environment. Okay, I think we need to see the slide.
Ni dah. Okay. Masakan lah. Nampak ni. Saya pancak kat situ lah. Sini nak besar macam mana? Apa ni? Yang tepi yang ada tak dapat media sini. Tapi saya baca yang bawah ni.
Okay, so I can control the slide? Boleh ya? Okay. So yang ni next slide please. Okay, yang ni. So antimicrobial, sorry about the delay, so I'm continuing now. The antimicrobial resistance or AMR is defined as when microorganisms such as bacteria, fungus, virus, fungi and parasites change in ways no longer responding to the medicine, therefore making infections harder to treat and increasing the risk of disease spread, severe illness and death. So this definition is defined by WHO 2020. And through the rapid evolution, bacteria, we have seen just now, one of the slides shown by Dr. Witness, bacteria can develop proteins and enzymes that protect themselves and destroy, next slide please. Yeah, okay. That protect themselves and destroy antibiotics. For example, beta-lactamases, which are enzymes that can destroy the most critical component of antibiotics. Yeah? Next, please. So we can see from the slide, the increasing antibiotic resistance. This is from CDC 2019. The cumulative number of unique beta-lactamase enzymes identified. And if you see here, the rise is exponential, kan? Beginning from the 1990s. Yeah? So it's quite, because it's rather worrying when you see a trend like this. Okay, next please. And as I think the first speaker also mentioned, it's a global, yeah? It's not only localized. AMR is a global rather than local issue because AMR can spread between countries and continents. Tadi Dr. Witness say apa? Everybody can fly, kan? So the bugs can fly, can be transmitted worldwide, as well as the genetic, yeah, that carries the resistance. So contributing factors are massive increase in trade and long distance travel, which enable the rapid spread of resistant pathogens. This is similar like with the epidemics and pandemics. Like if during the olden days, the main travel was by the sea. So it's, if you have an infectious disease, it gets contained in the ship, yeah. And usually, if we identify contagious disease, the ship is stopped from being from the ship, dia punya ahli ship to come on land. Is part of the easier to isolate. But when during our modern days now, everybody travel by air. So it's more difficult to contain the spread, and we have seen this in earlier epidemics, and the latest is the pandemics. We have seen this, yeah? And we are scared for the future ones because it will be very difficult to stop new pathogens. And okay, just now Dr. Witness also mentioned about the New Delhi metallo-beta-lactamase. The spread was from India to many Western countries. This metallo-beta-lactamase enable the bacteria such as the E. coli to become resistant to many antibiotics. This is the number. Next, please. Okay, this graph showed the average number of deaths due to AMR from 2015 to 2050, the projected number. Yeah? If we can see here, a lot of the countries, especially estimated US, Portugal, Greece, Italy, they are increasing in the number of deaths due to AMR. Next, please. And it doesn't only affect the death. When we say on the severity of illness, it's on the morbidity and as well as the fatality, yeah? So the number of deaths. But what does it mean in other sectors? So for example, in the cents and dollars, from the economic sense. So if we fail to address the problem on the antibiotic resistance, this could result by 2050, it is as projected can cost 10 million of death, and this amounts to about 66 trillion pound. Yeah. So if during the economic downturn, global economic downturn, this is certainly very worrying. And with regards to the epidemiology of the AMR, deaths attributable to antimicrobial resistance by the year 2050, Asia is the most populous continent in the world. So it is estimated about 4.7 million, followed by Africa. Okay. Okay, how about Asia? This is one article published, showed the prevalence of methicillin resistance among Staphylococcus isolates. And Asia is, some of the countries from Asia showed high prevalence. Yeah? Next, please. Okay, this one, total death projected by 2050 attributable to antimicrobial resistance every year compared to other major causes of death. You see the blue-colored wedge is a 10 million AMR as compared to other causes of, as compared to other diseases. For example, cancer is 8.2 million, followed by other diseases. So AMR is expected going to be the main cause of death. Yeah? Okay, this is another publication by Siri et al. 2023. What they did was a systematic review on the current evidence and future research directions. So they can see that if you see here, the circle here, it covers what we want to highlight, the One Health. Eh? One Health, because it's environment, it's human, it's the animals. So we need more research with the One Health approach. Next, please. So what I want to highlight in my lecture today is that the environment and the AMR, I guess we can call it pandemic now, are strictly linked. So the environment can be both a vehicle for spreading the AMR microbes as well as the culprit for the antimicrobial pollutants. We will see later in further slides, which negatively can impact the biodiversity and the ecosystem. Okay. So, for example, the relationship between the antimicrobial resistance and what we call triple planetary crisis of ada tiga. Ya? We have the climate change, the biodiversity loss, and the increasing pollution and waste. So, from the climate change, high temperatures and concentrations of oxygen and carbon dioxide in the environment will also have an impact on the influence of the survival and proliferation of bacteria and the rate at which they acquire resistance. So usually when kita kan, most of us, when we talk about pollution, we think of the impact on human health. And if the DVS on the animal lah. But actually from the pathogen point of view, they are also changing along with the changes in the environment. So at certain, due to the climate change, they can also acquire resistance. Okay, the next one is the biodiversity loss. The use of antimicrobials can lead to the loss of biodiversity, which used to protect us from the spread of antimicrobial resistance. Because when God made the world with a lot of biodiversity is to protect and for the sustainability of the species. But when we overuse the antibiotics, we also kill the yang commensal punya, yang non-pathogenic punya. So in that sense, we are reducing the biodiversity. And this is what, it comes back, the loss of biodiversity come back to us to cause a negative impact lah. And the next one is the pollution and waste. The discharge of pollutants into the environment can contribute to the development and spread of the antimicrobial resistance. We will see in further slide lah. Okay, so some of the, this is example of E. coli with the reacting with the pollution in the environment. Okay, so the importance, the curtailing pollutions created by the pharmaceutical, agricultural and healthcare sectors is essential to reduce the emergence, transmission and spread of superbugs, strains of bacteria that have become resistant to every known antibiotic. So now, we are talking about superbugs. Maknanya nothing can kill them. Ya, dia bukan Superman saja, superbugs. Every non-antibiotic used on them, they can resist. Yeah, they won't die. So yang ni after then we will be exhaustive lah. No more antibiotic to give. So, okay, sorry for the rather busy slide. This I took from United Nations Environmental Program 2020. Okay, we see from the top, yeah, because this is, I'm not sure whether you can see. Can you see yang ni kat belakang? This one is the human antibiotics. Okay, human antibiotic use, yang ni, jump by 36% in the 2000s. This is according to the United Nations. So this one, the environment is key to antibiotic resistance because bacteria in the soil, river and seawater can develop resistance through contact with the resistant bacteria. Maknanya in the environment there is existing bacteria. Usually it doesn't cause any, maknanya it's a biodiversity, it doesn't cause harm to us. But when they are exposed to the residual antibiotics ataupun the bacteria yang dah resistance to the antibiotic jumpa in the environment, then they pass, macam tadi Dr. Witness show, kan ada certain proteins ataupun phages from the resistant bacteria, they can pass it to the kawan-kawan dia di luar sana, kawan-kawan dalam environment. So if you, it's sort of macam berjangkit jugalah, the nature, the ability to resist berjangkit, yeah. So that's how, and they are more efficient. They are more efficient to develop the resistance faster than we, the human, want to develop antibiotics or antiviral or whatever, yeah. So and then that's how they are exposed here in the environment. And then if according to United Nations again, antimicrobial use for livestock will jump 67% by 2030. Because the human population is increasing. We are talking about food security, provision of food for everybody, for the population of health. So macam mana nak memenuhi keperluan tersebut, they use a lot of antibiotic to build up supaya the poultry semua sihat kan, so for the food production. So this will jump by 2030 in order to fulfill the need. And then when they use that, when this one will be, I guess Dr. Rohaya later will talk about it. Maknanya they use in the farm, but it goes back into the soil. So whatever is used in the agriculture, in the farm, will go back to the soil, will go back to the water, will even perhaps be present in the air, and it comes back to us all with the resistance genes. Yeah. And then we talk about, just now we mentioned about wastewater pollution. Yeah? So this is from the housing areas. So when sometimes we antibiotik yang tak habis tu, mungkin dia dah patutnya doktor bagi 5 days, 5 to 7 days. Dia 3 hari dia dah baik, so dia simpan. Macam tadi dia bagi anak dia kan. Tapi kadang dia tengok dah expire, dia buang dalam tong sampah, pergi kat dumping area dan masuk dalam soil, atau dia buang dalam toilet and then masuk dalam kita punya sewage system. So our sewage system tak boleh completely treat the antibiotic. Yeah? So this is a problem lah. So what else I wanted to show you. So macam ni, di sana more than 50% of municipal solid waste end up in the landfills and open dumps. And this one include unused or expired drugs. Sebab usually dia buang dalam tong sampah, dia tak buang. Actually it's supposed to be clinical waste. Ubat kan. Tapi population kita tak tahu. So dia akan yang ni. Yang macam ni, water waste yang daripada rumah ataupun daripada industri ataupun daripada hospitals. Perhaps wastewater treatment cannot remove all of the antibiotics. So dia masuk balik dalam sungai, dalam water system kita. Okay, so this will result in multi drug resistant lah. Okay. So next please. Okay, the spread of antimicrobials and the consequent increases in the antimicrobial resistance occurs especially through unsound release of residues into the environment. Jadi tadi macam dalam wastewater, tadi dalam macam solid waste, dan unintentionally bila kita use in the farms, unintentionally when we use in the agriculture field, unintentionally when we use in the aquaculture, dalam food production. Yeah? So ada residual ni, dan this will stimulate the antimicrobial resistant bacteria. And then environmental degradation and pollution factors connected to the triple planetary crisis of climate change, biodiversity loss and pollution alter the microbial diversity. Maknanya semua bila kita guna antibiotik semua mati. Kecuali even yang baik, yang kita kata baik, bakteria baik pun mati. Jadi yang tinggal hanya bakteria yang resistance tadi, yang superbug. So if we get the infection from the superbug tu, we will be in trouble. Because masuk ICU, physician bagi macam-macam. ICU punya doktor bagi macam-macam ubat, but the patient does not respond. Yeah, so okay. So this and also what is scary is that the ability of this bacteria to pass the genes, yeah, to pass the ability of resistant tu. Maknanya bukan dia je resistant, tapi dia jumpa kawan dia, dia pass. So kawan dia pun resistant juga. The dumping of these substances in the environment occurs mainly through the 5 pollutant sources. So we see next please. Okay, yang ni basically the 5 pollution, because I'm focusing on the environmental punya component kan. So these are the 5, 1, 2, 3, 4, 5. So for example, just now I mentioned dah kan, poor sanitation, sewage and waste effluent. So preventable use of antimicrobials due to disease burden caused by poor wash condition. This is water and safety and hygiene lah, yeah. Lack of sanitation or poorly functioning sanitation ataupun fragmented systems, example open defecation, poorly contained pit latrines, septic tanks and sewers that contaminate water sources and spread of AMR. So when we talk about globally, katalah Asia punya kontinen, tak semua negara ada macam kita consider developed country lah. We have a proper sewage system, we have potable water, ya, drinking water semua tu. And then kita ada indah water. Tak semua country ada indah water. So some country tu open defecation direct into the river. And then even in our country pun some sections, some community yang rumah atas air semua tu they are direct defecation into the antimicrobial resistant punya bacteria. Fecal sludge and wastewater biosolids. And then releases from unused drugs disposed in toilets, bins or waste dumps. Leaching. Lagi satu, kita banyak juga di Malaysia open dumping. Kan macam kadang-kadang kat situ jangan buang sampah, kat situlah buang sampah. So sometimes people buang pil ke apa kan, antibiotik yang lebih tu, tiba-tiba hujan so ada run off water. So the antibiotik tu campur dengan bakteria yang resistant tu can leach into the soil and perhaps the underground water. And then urban runoff. Urban runoff ni bila hujan masuk air yang daripada hujan tu can expose lah masuk dalam sungai. Number 2 is from the effluent and waste from the pharmaceutical manufacturing. So high concentrations of antimicrobials in untreated effluent, residual antimicrobials in solid waste discharge from pharmaceutical fermentation processes. So this wastewater from this institution might not be treated. Maknanya even let's say if they have the treatment facility, tapi mungkin tak semua yang can get rid of the antimicrobial yang resistant microbes. Okay, next one adalah from yang ni, effluent waste from healthcare facilities. Antimicrobial products and residues in hospital solid waste, resistant microbes including those with more abundant and diverse ARG. So antibiotic resistant genes. Dia boleh transmit dia punya resistant genes tu. And also the antimicrobial residues. Okay. And then this one adalah dalam production, animal production dan crop production lah. Food production kat sini. So fungicide, herbicides, heavy metals and antibiotics are used in the production of food dan juga feed dan juga raw materials. Sometimes dalam makanan dia untuk bagi dia gemuk ke apa kan, ataupun air dia tambah untuk menjadikan animal tu lebih resistant to the diseases. Tetapi we are encouraging actually the antimicrobial resistant genes And then untreated manure, untreated manure and wastewater that may contain pharmaceutical residues, the ARGs tadi, antibiotic resistance genes and resistant microbes intentionally applied to the soil and the crops. And also after that, inappropriate disposal of unused antimicrobials. Contohnya fungicides. Okay, number 5 yang ni releases effluents and waste in animal production. Manure and effluent from aquatic and terrestrial animal production that may contain pharmaceutical residues, ARGs and resistant microbes. The application of antibiotics and parasiticides in aquaculture that go directly into the environment. Sebab kalau you use in aquaculture, macam mana you nak prevent? You usually they do aquaculture in the adjacent to the sungai kan. So the residual antibiotic tu will flow into the river water. Okay, next please. Next slide. Okay. So the United Nations Environmental Forum or UNEP recognize AMR as one of the most critical pollution issues for the environment. Usually kalau biasa kita akan worry about the heavy metals kan, pesticide, chemicals. But this is the biological component, biological hazard. The importance of the dynamics between environment and AMR has been recognized as part of multi-sectoral One Health approach. Yang ini yang kita nak wawarkan ataupun kita nak highlightkan. The One Health approach as mentioned by Dr. Witness tadi. So what is One Health approach? I think actually kita dah practice One Health approach, but I guess we need to strengthen and certain platform and what are the platforms that we can strengthen them. For example, sebab dia memang multidisiplin. So these are the sectors and discipline. We see the problem encompass the human health, the animal health as well as the environmental health. So how do we jive them together? Macam contohnya dalam National Action Plan yang Dr. Witness tunjuk tadi, we have the awareness, we have the surveillance. Ada 4 faktor tadi kan? So tapi actually all the sector dia ada dia punya yang 4 tadi. But how do we jive them together? How do we communicate? That's the challenge lah. So that's what One Health is all about. We need to macam contohnya sharing of information macam ni. Maknanya mana tadi? Collaboration, communication, coordination and capacity building. Tadi macam yang Dr. Witness tadi is more to human health. Betul? Human health kan? National Action Plan. So more of human health. I'm sure Dr. Rahaya pun ada nanti for the animal health. And then the DOE pun ada for the for the environmental lah. Tapi what are the platforms? What are the meetings? Kita ada tapi mungkin nanti yang expert di dalam audience ini pun mungkin boleh cakap di mana lagi yang kita, what are the gaps? Di mana lagi yang kita perlu strengthen the communication and the coordination. So at the end of the day, One Health ni target dia is to get kita, kalau kita doktor, medical doctor, human doctor ni kita nak healthy human lah. Kalau macam Dr. Rohaya and team, dia nak healthy animals lah. And kalau environmental punya people, we want the healthy ecosystem. Because these two cannot live healthy without this one, without the healthy ecosystem. Okay. So yang ni and then we need the support sebab kita from the industry, kita from the ministry, kita from the services, macam saya dari research contohnya, tapi we need the commitment of the population lah, maknanya semua orang. So we need to work at the local, national, regional and global. Sebab pollution ni dia cross border. Dia tak pollution kat Malaysia tak pergi kat Thailand, atau pollution dekat Singapore tak datang kat kita. So kita sometimes bukan sometimes, maknanya memang kenalah for regional and as well as global. Okay, and then we are talking about rural, urban and also the mobile communities, macam orang asli yang rural dan urban. Important because in future more population of the world will be in urban setting, will be in urban cities. So inilah One Health-nya yang kita nak promote and wawarkan ya. Okay. So this slide, this slide pula yang this slide just nak summarisekan balik. Maknanya we are looking at the environment. So kalau environment macam Dr. Witness yang ni lah, wildlife ni ya. You punya ni, so yang kuning ni wildlife. Because wildlife also, sebab dia wildlife, dia bergerak, dia bukan macam domestic animal, dia stay. Jadi dia akan help to propagate ataupun transmit or whatever the microbial, the resistant genes ya, dia akan ada. And then yang ni yang coklat ni is the soil, the water, this is the environment part lah. This is the air ya. So if you see here, dia berselirat. Dia bukan dalam satu kokon macam tu, tak. Dia berhubungan rapat. Dia bernetwork, berselirat lah. So maknanya what does that imply? That imply that the control will be very challenging. Ya, dia bukan, it's a complex punya situation. So contohnya macam yang ni, kalau water, drinking water and recreational water. Yang ini kalau kita cakap pasal aquaculture, dredging, landfill ni, yang di mana mereka mungkin akan menjadi sumber contamination atau pollution kepada water kita. Yang ni kalau discharge ya, dari, contohnya dari livestock farm, kalau dia ada guna antibiotik, so this antibiotic residual discharge into our water. Ya, yang ni daripada sewage or wastewater macam kita cakap tadi, can go back into the water. And daripada water ni dia connect pula dengan soil. Ya, macam tu. Okay, I think next please. Okay, antimicrobials coming from these sources are present and transmitted through water, rivers, contohnya rivers, lakes and sediments, sewage, soil, air and wildlife. Macam kita tengok dalam gambar yang sebelum tadilah. They represent a serious threat as their spread is not limited to the specific point where the contamination occurs. But it spread in a diffuse and non-source way. So sometimes it spread, we don't know where it came from. Yeah. But when we test, kita buat sampel, kita buat surveillance, ada. Tapi dari mana, tak tahu. So bila kita tak tahu dari mana, that's the problem, how to stop or reduce it. In the past years, due to the COVID-19 pandemic, zoonotic diseases have raised attention and maknanya everybody focus on zoonotic sebab dia tahu apa COVID-19 ni. And as antibiotics are more frequently used in animal punya production, resistance is rapidly developed and spread through the environment in the shape of unmetabolized antibiotics. The transmission of diseases from animals to humans through zoonotic pathogens bear the risk of communicating also antibiotic resistant genes. Yang tadi itulah ya, ARGs through contact or consumption of animal products. So the transmission of gene ni berlaku dengan sangat cepat dan sangat cekap. More than we can make the antibiotic. Yeah. So therefore, people working, and then another point is that people working in or living close to livestock facilities are at risk lah, at higher risk as compared to the general population. So, United Nations Environmental Program ada 2023 ada publish online. You can get this online, the documents ya, in detail that they have. Maknanya bracing for superbugs. Strengthening environmental action in One Health. Dia pun pakai One Health approach response to the antimicrobial resistance. Okay, this one yang ni lah ya, dia maknanya again One Health, this one human health, environmental health and animal health. We have to communicate together and kita panggil One Health lah. Maknanya it encompass macam contohnya food security and kita punya dietary intake, and then antibiotics and other antimicrobials, intensive livestock farming. Yang ni kalau dari segi animal health ya, intensive livestock farming and the transmission of disease lah, disease vectors ni. And then from the environment is the biodiversity loss because of maybe urbanization or industrialization, berlakunya deforestation, industrialization and human population ni, air pollution, water pollution and climate change. Ini yang 3 planetary crisis tadi tu. And these are the human health part pun. Don't forget about the social determinants as well as yang tadi tu everybody can travel, population movement, because this propagate ataupun this facilitate ya the transmission of the ARGs itulah. And social determinant tu kita punya behavioral, kita punya attitude, perception, culture, belief tadi tu. Maknanya ayah bagi kat anak dia tak payah jumpa doktor, passing je kan. Tu practice. Kadang nak that one maknanya kita kena involve juga social scientist to come in, macam mana nak ubah. And macam Dr. Vignesh cakap tadi, we cannot sometimes in the community we cannot impose our values. Dia takkan buat. We need to macam together dengan dia to pujuk dia so that they can practice the safe behaviour ya. Okay, this one Health lah. I think based on National Action Plan tadi memang dah ada lah all these diverse all these various sectors, various community, various institution and ministries ya, department semua tu, plus the NGO, plus the community as well. Okay, we need to have buy-in. I think important juga from the community lah, to make them believe and accept what we are trying to tell them, and then this one, the strategies. I'm coming to a few of my last slides. So the need for surveillance of AMR in environmental setting has well been established, and WHO dia ada keluarkan publication dia yang dia panggil WHO Tricycle. Dia ada cakap lah pasal environmental surveillance. Tetapi for example in human health memang ada, Ministry of Health ada buat surveillance, DVS pun I'm sure we have, and environmental punya komponen ada, tapi mungkin I'm not sure, mungkin they do regular one. Perhaps some of you from the environmental part will be able to say this lah, but if according to WHO, sometimes they depend on the local requirement for the environmental sampling tu, sebab kita nak sample apa. Contohnya nak sample from soil, nak sample from water, nak sample from air, dia besar, so and then it also depend on the time that you sample. Jadi those are the things that we have to take into consideration when we talk about the environmental sampling. So okay, it should be driven by the kita kena buat environmental risk assessment dulu, and then before we decide, because all this sampling kan kita sample kita kena hantar ke lab, all these are costly. However, it is necessary. So not every location or time frame will benefit from the same surveillance approach, and much will depend on the agricultural, ecological, veterinary and public health objective that are being served at that time and in that location. Maknanya kita tak boleh generalize. Kita mungkin ada a few guide, tapi kita tak boleh semua generate je. The different location will require perhaps different kind of sampling, timing ke, frequency ke apa. So sebab tu dia kena buat environmental risk assessment dulu. Okey, yang ni contoh yang dalam tricycle tu, dia just nak tunjukkan apa ni, surveillance ya. Contohnya surveillance in food chain, contohnya chicken. Yang ni chicken, dia ambil sampel from live bird in open market in major cities. Ni example lah. And then ni surveillance from the environment. Maybe you can take sample from the river, upstream, downstream, and then wastewater from the slaughterhouse, ataupun wastewater from the human punya penempatan. Okay, so this one is the this one is the tricycle punya global yang ni ni suggested by the WHO lah. Yang macam ni carbon yang ni dia tengokkan surveillance, some suggested surveillance. Okay, I think this is my last slide. The impact of antimicrobial pollutants on AMR in the environment is very complex, as we have seen in the diagram earlier, and necessitates further evidence. So the pollution of waterways, soils and air are certainly contributing to the environmental degradation, as well as increasing levels of antimicrobial resistance. So the final take-home message is that we need the healthy environment to improve, to reduce the increasing trend of the antimicrobial resistance. So we need a healthy environment for the antibiotics to work. So I end my slide. Ni adalah yang we do not inherit the earth from our ancestors, but we borrow it from our children. So we must maintain the the environment, the healthy environment. With that, I thank you.
Thank you, Dr. Rosita, for the insightful talk. Ladies and gentlemen, kindly allow us to present our last speaker of the day, Dr. Rohaya Muhammad Ali, who will address the topic looking at AMR from veterinary perspective. Dr. Rohaya is a Senior Director of Veterinary Public Health at Department of Veterinary Services. She holds a Doctor of Veterinary Medicine from UPM and has extensive expertise in antimicrobial resistance. Despite her demanding role at DVS, she remained actively engaged in scientific work, having published various articles on AMR-related issues. Dr. Rohaya's commitment to addressing AMR is admirable, seen through her extensive engagement in essential initiatives on both a national and international level. Please welcome Dr. Rohaya.
Dia memang kosong ke dalam?
Ada yang satu lagi tapi
Kejap saya try balik ya. Saya try buka balik. Memang kosong ke dalam?
kenapa
tak apa.
kosong?
Mungkin dia tak
Kalau dekat saya punya ni boleh. Saya punya email.
saya try buka balik dulu dari sini, tengok dia dapat detect ke tak.
Kosong.
Okay, bukan.
Kosong Ada.
Oh, memang kosong. Memang kosong kat
So
dalam.
macam mana? Saya ada. Kenapa tak beritahu?
Tak ada, saya baru nampak tadi.
Nah, mana dia kosong? Pelik ke tak? So saya nak kena.
Tak apa, saya ada satu pen drive lagi kat sana, saya cuba dulu ambil. Kejap
Pun
Kita tengok dulu. Oh, ini tak. Oh, kosong juga.
so saya boleh kosong. Boleh. So saya email ke you, ada email ya? Forward
Boleh. Rahil, R-A-H,
R-A-H
E-E-L,
E-E-L
at, ya.
Ingat elok pergi minum dulu.
Okey, boleh nanti saya bagi terang, kita take time sekejap. Copy dulu.
Sorry, ada technical problem sebab slide saya yang hantar tu tak ada, kosong. So
We will have a short 5-minute break before we start the session. Drinking water is provided outside of the auditorium for all the participants.
hello.
Yang diorang send bagi saya tadi kosong dalam dia, Doktor. So saya minta Dr. Haya email balik. So dah dapat. Dah, ni lah dah dapat dah.
Alright. Nanti siapa control slide? Boleh. Macam mana? Tekan kiri kanan.
Ladies and gentlemen, please be seated because we're going to start our session soon. Okay, without any further ado, please welcome Dr. Rohaya to deliver her talk. Thank you.
Okay, thank you, Mr. Chair. Bismillahirrahmanirrahim. Assalamualaikum and very good morning, everyone. First of all, I would like to thank the organizers of this seminar for inviting me here. This morning, I would like to present my topic about looking at MR from veterinary perspective. Okay, as you can see on the screen, my topic will cover introduction, MR in livestock and how animal husbandry influence on MR, the contribution of companion animal in MR spread, aquaculture and MR, MR in environment, one health approach to face MR, tackling MR in animal health, and also conclusion. So this morning we already had from both our speaker. Because my slide, some of my slide already covered by them, so maybe I can skip if necessary. Okay. So as in introduction, we start with the definition of antimicrobial agents. So antimicrobial agents are defined as natural, semi-synthetic or synthetic substances that kill or inhibit the growth of microorganisms such as bacteria, viruses, parasite, fungi, and algae. Antimicrobial are important for animal welfare, but should be used judiciously and prudently. What is antimicrobial resistance? Antimicrobial resistance is a natural process, actually, has been observed since the first antibiotic were discovered. So, however, AMR has become more of a problem lately because overuse of the ability of microorganisms to persist or grow in the presence of drugs designed to inhibit or kill them. Say antimicrobial resistance is excessive or inappropriate use can lead to the emergent or resistant bacteria which do not respond to antibiotic treatment. Okay, I think this already covered by Prof. just now, so I can skip this slide. So, okay, this is also some of my slide covered by Prof, but I will elaborate more on how antimicrobial resistance happen. So, under normal situation, there are many of good microorganisms or germs. Only a few of them are drug-resistant organisms, right? Here. So, antimicrobial or antibiotic will kill bacteria that cause as well as the disease bacteria and also the good one. Okay. However, in a situation of misuse or overuse of microorganism, the drug-resistant bacteria and the drug-resistant bacteria are now grow. Tak nampak. Sorry, wait. Cursor tak ada. Oh, dia kat sini tak ada. Mana? Kat mana nak turunkan ke bawah?
Kalau dia kena cursor dekat sini. Dah dekat sini dah.
Oh. Oh, okay. Okay. However, in situation of misuse or overuse of microbial, drug-resistant bacteria are now allowed to grow and take over. In some cases, some bacteria give their drug resistance to other bacteria, causing more problem. So, how antimicrobial spread? In animal, develop the resistant bacteria when they get the antibiotic and develop resistance. So the resistant bacteria will be present in meat, and when meat is not handled and cooked properly, resistant bacteria sekejap The resistant bacteria can spread to human. The same goes for manure or water containing animal feces that has been contaminated with drug-resistant bacteria. Drug-resistant bacteria in animal feces can remain on plant and are eaten by human, causing this resistant bacteria to remain in the human guts. So let's say this guy has developed resistant bacteria in his gut. If he stay in at home and in the general community, he can spread the resistant bacteria to others. Equally, if he goes to hospital, resistant bacteria spread directly or indirectly to the patient, to other patients. So alternatively, resistant bacteria also can spread to others from surface within the healthcare facilities. When patients go home, they take the resistant bacteria with them and spread to others in their family member. Now we move on the risks of MR in animal health. So first, MR will make existing antimicrobial drugs are no longer effective for the treatment of animal disease. Second, infection of animal disease cannot be controlled and the death rate of animal increases. Third, threat to food security for animal-based product, and as well as threat to public health due to foodborne pathogen and zoonotic pathogen infection. So now we come to AMR in livestock and how animal husbandry influence on AMR. So as you can see here in the slide, the population of livestock in Malaysia for 2018 to 2022. So livestock or food producing animal in Malaysia are one of the most important sectors in the development of agriculture in Malaysia. So here data in 2021-2022 from the Department of Veterinary Services shows that shows that chicken is the highest or largest livestock population, followed by ducks, pigs, cattle, goat, and sheep and buffalo. In general, antimicrobial are used mainly for treatment and therapeutic to treat sick animal that have an infection, and also used for metaphylaxis. However, routinely, they have been also used as disease prevention or prophylaxis when outbreaks of a disease in individual, animal, or groups of animal are expected. Currently, the industry in Malaysia still practices the use of antimicrobials as prophylaxis. So antimicrobial shall not be used for prophylaxis other than in exceptional cases for the administration to an animal, individual animal or a restricted number of animals when the risk of the infection or of an infectious disease is very high and the consequences are likely to be severe. So the administration of prophylaxis should under strict provision of veterinarian. So a study by Nguyen on the effect of prophylactic and therapeutic antimicrobial use in small scale chicken flocks found that the use of prophylaxis does not protect against a disease. On the other hand, it will increase the risk of disease in some conditions such as increased risk of diarrhea and respiratory infection. Antimicrobial also has another effect over the growth rate and increase the production of animals by inclusion of low doses and have been used prolonged in feed. The same practice also commonly occur in Malaysia. This is prohibited in several countries, but some of the countries in the world still use antimicrobial as a growth promoter or as a AJP. So now we come to the contribution of companion animal in MR spread. As we know, dogs and cats are often considered as family members or companion. In many countries, the companion animal population is dramatically increased. So the number of dogs and cats in Malaysia, including pets and stray, have increased over the year. However, the ownership of dogs are at 300, almost 400,000, and cats almost about 650,000 in 2019. So MR in companion animal is problematic in many pathogen and common cell, including Staphylococci, Enterococci, E. coli, and Salmonella. So increased contact between animals and human leads to a higher risk of infection and cross-contamination of MR. As Dr. Witness said, bila kita cium ya kucing ya ataupun siapa yang ada bela anjing ya, of course the cross-contamination is there. So in addition, it is also possible for the occurrence of reverse zoonotic. Not even zoonotic means that animal to human, but also human to animal. And we move to producing Enterobacteriaceae and gram-negative bacteria. So, whereas recent example for human transmitting pathogen to animal includes methicillin-resistant Staphylococcus aureus, influenza A virus, Cryptosporidium parvum, and Ascaris lumbricoides. As you can see on the screen are the papers shown related to the study of MR in companion animal. So now we go to about the aquaculture and MR. Aquaculture production account for almost half of the fish and fish byproduct consumed worldwide, and is moving towards intensive and semi-intensive production practice. Consequently, antibiotic usage for both therapeutic and non-therapeutic purpose is dramatically increasing. To date, improper use of, to date, no antibiotics have been specifically designed for the exclusive use in aquaculture. Therefore, improperly use of human and veterinary antimicrobials such as sulfonamide, penicillin, quinolone, tetracycline, and penicol is in the aquaculture dramatically enhancing the effect of initiation and spread of MR. Furthermore, inadequate usage of antibiotic is associated with a reduced capacity of the fish species to effectively metabolize the administered drug. In addition, it is estimated that 70 to 80% of the active compound are eliminated through the feces, which allowed the spread of antibiotic through wastewater, thereby affecting the ecosystem. So now we come to MR in environment, but I think Prof. Rosita already covered in depth. So just maybe just to highlight the point that major pollution source from animal production manure and effluent from aquatic and livestock may contain antimicrobial residue or resistant pathogen. Okay. So these are some of the papers shown related to the study of MR in environment. Okay, also next, One Health approach to face MR. I think Dr. Witness already covered, on this topic. So the One Health approach is defined as a collaborative effort of various disciplines that come together to provide solution for human, animal, and also environment health. So why do we need One Health approach to face MR? So because MR is a very complex issue and has a global health concern and a major threat to human health. So we look MR as a challenge, considering that antimicrobials as an important tool in maintaining animal health and welfare. So One Health action focus on the responsible use of antimicrobials, disease prevention and control, the surveillance of antimicrobial consumption, as well as MR development and spread. So same structure organization of the NRC as Dr. Winas mentioned just now. We have code chat by DG of Health and also DG DVS. And we have under the NRC, we have 4 technical working group, 1, 2, 3, 4. Okay. Okay, and also the membership consists of various disciplines and across sector as an effort to address the issue of MR. So, in conjunction with NARC, the first phase of the Malaysian Action Plan on Antimicrobial Resistance, MyApp AMR for 2017 to 20. Oops, sorry. Itu kan? Salah. Itulah. Was developed lah. Just now, Dr. Ines cannot tell more about the second version of our MyApps MR for 2022 until 2026 because not launching yet, right? Okay. The implementation of the MR National Action Plan is carried out in stages through 4 technical working groups based on their respective strategic mentioned in the document. So on this screen show the 4 objective strategies of our MyApps MR. Okay. So, okay, now we move to tackling MR in animal health. Okay, as we know, farmers can avoid antimicrobial misuse by improving animal health and strengthen farm biosecurity. So DVS has introduced and implementing good animal husbandry practice through the MyGap and also My Organic Certification Scheme. So the department also involved in development of MS 2027 2018 Good Animal Husbandry Practice or GAHP. In addition to that, good animal husbandry practice will be able to ensure the production of animal-based products that are of the good quality and safe for human consumption, safety and welfare of animal and farm workers. So number 2, to promote, strengthen, to promote vaccination to prevent an endemic disease. As we know, vaccines are considered among the most cost-effective to prevent morbidity and mortality from infectious disease. So the Malaysian government, through DVS, has funded the procurement of vaccine for diseases of economic and zoonotic importance, such as FMD and brucella for farms. And in addition, DVS also facilitate and increase the availability of vaccine, and also always encourage a greater uptake of available vaccine in the market for endemic disease as well as for new emerging and re-emerging disease in the country. Actually, jabatan banyak juga membeli vaksin ya, untuk penternak ya, dan kita selalu galakkan penternak untuk ambil lah ya vaksin dengan jabatan ya. DVS also from time to time improving vaccine registration and licensing vaccine importers. Also, DVS also promote effective vaccination program for livestock and companion animal in order to prevent the existence of disease, to control the spread of disease, increase animal immunity, and also to reduce the use of antimicrobial in animal. Number 3 is to strengthen surveillance of MR research and laboratory capacity. So DVS coordinate and integrate animal surveillance in animal health to provide a more complete picture of antimicrobial resistance that can facilitate analysis of trend over time and across animal sectors. So DVS also work with other agencies, industries and academia to share surveillance data. So explore new monitoring tools such as whole genome sequencing and other molecular-based methods to improve and add value to our surveillance data. And DVS also collaborate with international organizations such as WOA, WHO, and FAO for MR surveillance training. DVS also harmonize One Health MR surveillance, including laboratory methodologies and data reporting. We also support research to reduce evidence gaps and improve understanding of the risks from MR in the environment. Actually, environment sector just involved within 1 or 2 years, a bit late. Before that, we just between MOH and DVS, also DOF. Okay, environment just come to the committee. Okay, started in 2017 and focus on the our surveillance, MR surveillance in animal health sector. Focus on pig, poultry, which is broiler and layers, and dairy sector related to zoonotic, Salmonella species and commensal bacteria, E. coli, in both live and product of animal origin, and chicken. So we have done about over 5 years, and we found that there are some antibiotic that are resistant to the Salmonella and also the E. coli. We test about more than 10, about 12, I think, antibiotic for the surveillance. Okay, and we found that most of our broiler, layer, pig, and also for food, chicken meat and pork meat already resistant to ampicillin, tetracycline, and also I forgot the name. Okay, we started our surveillance and started our surveillance in 2017 until now. Okay, this is just to show some research initiative involved with NRC. So number 4, DVS has established an MR policy by prohibiting the use of critically important antimicrobial CIA in humans and veterinary critically important antimicrobial in phases by 2025 under the Feed Act 29 for certain antibiotic in food producing animal for growth promotion and prevention. So DVS also improve available data by renewing licensing requirement under state enactment to include antimicrobial use as a condition for license application or renewal. DVS also regularly monitor the use of antibiotic and MR in food producing animal at farm level and restrict the use of critically important antibiotic in human as also as growth promoter and prophylaxis. So curative and metaphylaxis use possible only after clinical examination and necropsy sampling and identifying the bacteria and sensitivity testing are done. Okay, this graph shows the total of antimicrobial use from 2027 to 2022. 2017 to 2022. So as we can see, the trend is decreasing over the year. So maybe we already banned some of the antibiotic from AGPs and prophylaxis. Okay, and the most higher and frequent use antimicrobial just now I forgot chloroquinolone, followed by penicillin and tetracycline. This is the most usage, but the most resistant just now I said is ampicillin, tetracycline, and also chloroquinolone. Tak berapa nampak Okay, this slide shows the pharmacovigilance program run by DVS on farm, vet clinic, pet shops, and other premises. Each year, DVS submit data on antimicrobial use in animal health to OAH also. Okay, so far Malaysia has banned the use of nitrofuran, chloramphenicol, beta-agonist, and colistin for all purposes, AGPs, prophylaxis, metaphylaxis, and treatment. For the colistin polymyxin E, we only allow for external usage. Okay, meanwhile, in 2021, a total of 6 more antimicrobial have been banned for use in animal feed as growth promoter and prophylaxis, but they still can use for treatment. So these antimicrobial are erythromycin, enrofloxacin, tylosin, cetiophor, tetracycline, and fosfomycin. Malaysia also has developed a three-year roadmap 2023 to 2025 to guide the phase out of 23 more medically important antimicrobial as growth promoter and also prophylactic in animal feed. So mereka tak boleh lah nak campurkan all those antibiotic dalam makanan haiwan ataupun makanan ternakan lah. Especially for the food producing animal lah. Kalau companion tu kita tak kisah sangat kan sebab kita tak makan. Okay. So, public awareness campaign related to prudent use of antimicrobial agent can, to some extent, reduce the misuse of antimicrobial in food production animal. So, throughout the year, DVS support and conduct a series of ongoing activities to enhance and strengthen the awareness of MR and MU for the community and different target group of stakeholders, including pharmaceutical wholesaler, veterinary practitioners, animal feed producers, school or higher education healthcare worker, environmental health, and also others. DVS is also very committed to organizing WAAW every year through One Health approach, as well as develop the antimicrobial resistant awareness toolkit for training and education purposes to increase the knowledge and competence of extension workers, health workers, and technical staff in the field in the target and effective way through MR-related education and training. We actually have developed ARAT, which is antimicrobial resistant awareness toolkit, as awareness and educational material. So now I come to my last slide. In conclusion, DVS at the Ministry of Agriculture and Food Security, KPKM has been working with other agencies to deal with the MR problem in Malaysia, because MR is a major threat to food security and food security and food safety in this country. DVS, together with the stakeholders, livestock industry, players, farmers, and veterinarian, committed to implementing the National Action Plan in minimizing the emergence of the MR. And antimicrobial are an extremely valuable resource in livestock production. Their prudent use in animal will continue to provide benefits to society and will help ensure high standard of welfare for those animals in our care. So the spread of animal AMR should be slowed down and reduced to maintain the effectiveness of existing antimicrobial drug for animal and human treatment purposes. So with that, I would like to thank you for your attention.
Thank you, Dr. Rohaya, for the talk. Ladies and gentlemen, we are going to have a 10-minute break. So please be sure to return to your seats by 5 p.m. as we have an interesting discussion with all our speakers after the break. Thank you.
Distinguished guests, continuing with our itinerary, we would like to invite our honorable speakers for the panel discussion entitled One Health Approach to Antimicrobial Resistance. This panel discussion will be moderated by Dr. Rafiza Shaharuddin, the head of the EHRC. Please welcome Dr. Rafiza, Dr. Vineshwaran, Dr. Rohaya, and Professor Dr. Rosita.
Kalau duduk kurang sikit.
Assalamualaikum and a very good afternoon to everyone. Okay, now we will have our panel discussion, and I hope that everyone has prepared their questions to ask to our very esteemed speakers. Okay, I will just like to recapitulate what our speakers have presented just now. Dr. Vignesh, he started off with asking the question about scurvy. So I was thinking, all right, what has vitamin C deficiency has to do with AMR? But he was just like leading us along towards the National Action Plan. So anyway, he also covered about how disease now can transmit because everyone can fly now. And I'm sorry that we only could give you 45 to 1 hour session and not the 2 days and 1 night that you request, okay? So anyway, the National Action Plan, as you know, is not launched yet. So Dr. Vignesh very briefly just showed us with the disclaimer that no photos. And don't spread it yet until it has been launched. So basically, the National Action Plan will have 4 working groups. The TWG 1 is to create awareness and education about AMR, and then the second TWG is it involved about surveillance and research. TWG is on infection prevention and control, and TWG 4 will look at prudent use of antimicrobials. So let's wait for the launching next month. So he also emphasized on the NARC, the committee and the working groups, and the coordination between national and local levels. And we need and the importance of that data for action. Next, we had Prof. Rosita Hoth, who gave on AMR in environmental the environmental perspective, the key players driving environmental emergence and AMR spread. So it's quite scary to see that the estimated or the projected burden of disease due to AMR in 2050, which would lead to 10 million deaths, and also will cost us about 66 trillion pounds to overcome it, yeah? The total cost. So AMR and what's scary also is because of the population abundance in Asia and Africa, so most of the death will be from these continents. And AMR how AMR and the Triple Planetary Crisis Association of AMR and Triple Planetary Crisis of climate change, biodiversity loss, and pollution and waste. So pollution will be mostly from the pharmaceutical side, from agriculture, and also from the healthcare. And it's also scary that antibiotic use has been increasing about 36% in humans, 66% in livestock by 2030. And I wonder whether it is actually unintentional use or is it really with intention, okay? And the 5 sources of AMR is from the poor sanitation, sewage and waste effluent, from pharmaceutical companies, effluent from the healthcare, antibiotics use, antibiotic release in manure and also use in crop production, and also antibiotic use in effluent from animal production. So Prof. Rosita also talked about the One Health approach, the importance of collaboration, communication, coordination, and capacity building among various sectors and disciplines and also societies. Our last speaker was Dr. Rohaya Muhammad Ali, who looking at AMR from the veterinary perspective. So it's interesting to see that how Dr. Rohaya started off with antibiotics are no longer effective for animals and they shouldn't be used as prophylactic treatment, but how much of it, how much of the livestock producers are aware of this, you know, the practice is still there. But whether it is being communicated to them. So, and also we know that due to food security, livestock production has increased from 274 million to 290 million in 2022. So, and Dr. Rohaya also touched on the action plans to reduce AMR in veterinary services, which is to promote animal husbandry, to prevent endemic diseases where they have also where they have developed the MS 2027 in 2018 for good animal husbandry practices, and promote vaccination and prevention of endemic diseases, especially in FMD and brucella, and also in companion animals, and also to strengthen surveillance of AMR research and laboratory capacity, where there needs to be collaboration with multiple organizations. And Dr. Rohaya also presented to optimize the use of antimicrobes in animals, to monitor the use of antibiotics and food production animals, and lastly on antimicrobial usage and AMR awareness campaign programs. So with that, I would like to open the floor if there are any questions to our esteemed speakers. Are there any questions? You can use the speakers available on both sides of the hall, and please identify yourself and ask the questions to which speaker you want to ask. Yeah, Prof. Noazia.
Okay, thank you very much. I'm Norazia from UKM. Thank you very much for the organizing a very good forum, I think. Right, I'm from the research group, I think. Right, so yeah, in UKM we have established a novel antibiotic research group that's maybe for 20 years, that finding the new antibiotics from soil, from plants, you know, and we have several interesting compounds. But the thing is that when we develop the active compound, is to see whether is good enough to be used for the human use, for the in vivo study is not there yet, because in Malaysia we don't have enough facility to develop, like for the first trial or the second trial. So for now we just is developed as to be used as a supplement or the atopic preparation and using just in vivo, just using the animals, not human yet, right? So how is like MOH or other grants body or maybe IMR per se that can involve as well for the developing a new antibiotics and then to combat the antimicrobial resistant bacteria. Number one. Number two, that I think the collaboration between the university and the IMR so far, how it can be what you call it, to be strengthened, you know, in terms of we have the manpower. Yes, we have students, we have in UPM as well, I think, but the collaboration in terms of research, finding a new drug or testing a new antibiotics is not actively yet, maybe. Yeah. Number three is I'm talking about the environment sample. I'm really interested to when Prof. Rosita said the very important this sample, you know, sample collecting, how you collect the sample, how you prepare the samples for environment. Let's say from water. So we have how many liter, how many volume of the water need to be sampled in order to get that the bacteria per se, and whether the bacteria is carrying the antibiotic genes, for instance, whether they express the antibiotic properties. So that kind of thing, because the antibiotic genes they have maybe, but it's not to say that they are virulent compared to other bacteria. And how the if they have some, they say they have a prevalence. We can see that we know that already. How the horizontal the genes, antimicrobial genes, can be horizontally transferred from the human to the environment. But how the antibiotic resistant genes, when it's consumed by the human, and its reaction or communication with the microbiome, the gut, the microbiome gut in the human itself, how is enhanced the virulency between it, we don't know yet. So that kind of fundamental things also need to be strengthened. Sorry, too many things actually, because too many things in my head. So another thing is that we have some curriculum developed with the University of Yale several years ago that enhance or to make the students, school students, involved in this searching a new antibiotics properties. We go to many places. From the soil, you know, that's the one of the main producer for antibiotic from the bacteria soil, streptomycin and so forth. So that kind of things maybe in a way can stimulate the school children that now they are very, very very not interested with the science. You know, that kind of things that I think maybe need to do involvement of the KPT or whatever, that we can instill their love, their passion about the science. Yeah, because many students now wants to be a school children, not even go to the university, they are lost interest in science. So this kind of curriculum, I think we can more develop that suit the Malaysian culture and situation. Thank you very much.
Okay, thank you, Prof. Nur Azia, for the question. So I think for your questions, I need to the first question on development of new antibiotics. Who will be? Would Dr. Vignes would like to answer that, or?
Cuba, bukan bidang tapi cuba. Okay, let's say I'm a politician lah. So basically, as you know, R&D for antibiotic is high. Cost is high, but it's not cost effective. You get it? If I put a research on antibiotics, the cost for research is high. But when you do the marketing for antibiotic, you only take for 7 days. So as a company or as a looking into ROI, do you think it's a good investment? No, definitely no. Because why? I'm more interested in people eating medicine lifelong. Because the industry has changed. Before, you see, this antibiotics started during the World War II. World War II, they had massive casualties. Massive casualties with contaminated wound due to the war. They were contaminated to the environment. So when they were brought back to the health, where they treat those who are injured, you all tengok combat tak dulu? Waktu I kecil, I tengok combat. Itu tahun-tahun berapa tu? 17, I think, doktor tahu Rick, Jason dengan Rick Mauro, something like that. You see, that time, the antibiotics were introduced. Penicillin was introduced that time. So, first thing is, how are you going to get money? So, if Malaysia, kalau you want to come up with millions to billions to do antibiotic research, definitely we have to look into other priorities. So, if you want to look for grant, what my suggestion is, do a multi-sectoral research. That means involving human health, animal health, environment. Go for the, Bill Gates Fund. You go for Wellcome Trust Fund. Correct. No, you can. I kenal orang lah dekat sana. I kenal orang dekat Bill Gates. We kenal orang dekat Wellcome Trust. So kalau you all nak betul-betul buat, I boleh calling dia. Tapi I'm not a researcher. Right? The person who is in Wellcome Trust is my senior in school. So I can always Roger. So basically that's the part. So because just now Prof cakap yang kita tak ada scientific this one. Fine? Okay. So that is the research part lah. Other part is, I think I don't represent IMR lah. Sorry.
Okay, I will try to answer the part of collaboration with IMR. If you want to test your antibiotics the new products that you have developed, we have a GLP under Herbal Medicine Research Center. We have a GLP lab where they do testing on animals as well as other cell lines and things like that. So maybe you could approach, we could put you in touch with the person. Okay, so in that way, maybe we could collaborate. If it's a clinical trial under NIH, we have the Institute for Clinical Research. So then you will need to approach people from there, because maybe I take this a bit of time to promote what National Institutes of Health are. We are made up of 6 institutes here. So IMR is one of them and one of the oldest institute. We do biomedical research. Then we have Institute for Public Health that does community surveys, population-based surveys. And then we have Institute for Health Management and Institute of Health Systems Research. Then we have Institute for Clinical Research and Institute for Behavioral Research. So any of you interested to collaborate with any of our institutes under the National Institutes of Health could look through our website, nih.gov.my, and look at the appropriate person that you could contact. We also have the research that has been conducted under NIH, listed in the National Medical Research Registry, nmrr.gov.my. About when you ask about the sampling methods and such, we under EHRC, Dr. Zuraifa Asra and her co-investigators had done a study on antibiotic resistant bacteria and antibiotic residues in drinking water. And she has published the methodology and the scientific report. It is available online. Another researcher has also done on hospital effluent. The methodology is also published. You can look under the scientific report. So I will also ask them, the committee members, if they could list down our publications under AMR One Health research that we have done, and also the posters that they have done, so that it is available for the participants to look through. For your other question on involving students, maybe I pass the question to Prof. Rosita, who's also in the My Ohun.
Okay, thank you, Dr. Rafiza. Before I answer the question, I agree with Prof. Norazia. I would like to acknowledge my fellow Hon colleagues, Prof. Siti Hairani Bejo and Prof. Zunita from DVS, Faculty of Veterinary, University Putra, and Prof. Norazia, Faculty of Health Sciences, UKM, because we are part of the Malaysian one, and Prof. Latifah, of course, the head for coordinating center for Malaysian One Health University Network. I'm not sure whether, I think hopefully you all, the audience, have heard of My Hon, because we have been around, I think, 2012, about 2012, right? 2012, initially we started with UPM, UKM, and USM. And then the network grew larger. So part of the main objective initially of Malaysian One Health University Network is for the capacity building. So part of yang you punya first tadi tu, pillar tu, awareness, creating awareness is the objective. So every year we were given funds to run the training and the awareness program. So I agree with Prof. Azia, because we have to keep on instill and engage with the students, because they are our future. Because I had personal experience when I brought my group with this One Health training in one sekolah in Pahang. And according to the teachers there, the students student tu matricul form 5 dengan STPM lah. So majority did not choose science. They opt for the social science, yeah. Jadi nobody macam tak interested. So we were quite, personally I was quite shocked, because usually we aim for the science. So I think Prof. Nora rightly highlighted that we need to instill more interest. So you mentioned some activities where the student at level high school level boleh do their own culture ke, in the lab they have hands on, because I think the student cakap-cakap dia tak jalan. Sekarang ni the younger generation, they need to be hands on. Dia buat sendiri, they do it and they see, baru they are interested to get them buy in lah. Sebab it is worrying if they are not interested in the science lah. So our activities every year we do from the National Coordinating Center, which is based in UPM, but all the other IPTA, the major IPTA as well as IPTS are involved with the training and capacity building. So I think Prof. Azia, but I think another thing is maybe but in your stakeholder ada kan KPT, KPM, ada kan involvement. So Ministry of Education, Ministry of Higher Education ada, but we need more champions. I think more champions from atas sampai ke bawah lah. I think personally, because we have been running the training program for many years. Thank you.
I would like to also add that recently under the COHUN, Southeast Asia One Health United University Network, they also organize where they want to educate students from preschool about the importance of One Health, and AMR is one of them. So they had that meeting in Bangkok recently. So they also invited IMR, because IMR is the is the center for SIMIO in Malaysia. semiotrope man, and also at that meeting they also invited representatives from the curriculum of KPM, sorry, Kementerian Pelajaran Malaysia. So they are towards that. They're trying to increase the awareness and educate people, yeah, from small. So are there any other questions?
No, the other thing is that what I suggest is we as a parent or we are as in the industry of teaching, we should plant the apa tu the interest lupa tadi. Interest in our children, because we keep telling science is difficult, maths is difficult. We shouldn't do that, first thing. Second thing is that to change a country's curriculum is not a one-day process. You have to go layer by layer, layer by layer. That's another thing. So as how Prof mentioned, if they are in the medical school or what, it's much easier. They are more molded towards us. But when you are going down to the primary school, secondary school, it's going to be a bit a challenge working on the curriculum. So basically, let's give some time for the KPM to decide on the curriculum on science and so on. Because my son is standard 1. He only learned science 2 subjects, 2 period ke apa 3 period during the whole week. When I was in standard 1, we used to learn science like every day. So basically, the interest has gone. Because why? The subjects are not taught in the schools. I think this one we keep among ourselves lah. Okay, I'm not trying to criticize KPM or what, but we have to develop the interest for our children. Thank you.
Okay, thank you. Are there any other questions from the floor? Yeah.
Kalau tak ada soalan, I tanya soalan. Okay, meantime, do you know why antibiotics is used as a growth promoter? Siapa dapat jalan? Okay, so before you ask, let me tell you, because it's burning on me. Dulu, after World War II, we had marasmis and Kwashiorkor and mixed. Ingat? Sekarang tak ada. Ya kan? Protein deficiency and protein deficiency bukan buncit macam air. Air 8 pack tapi 1 pack. Okay. Macam ni. So when they give antibiotics to these children with food, they gain weight faster. That was the research was used by the producers because they wanted the mass production of livestock. Okay? Your question. Sebab you tak tanya, I tanya.
Thank you for the great forum today and good morning to everyone. I'm Sri Devi Devadas. I'm a research officer from Department of Fisheries. Okay. Currently, I'm actively doing AMU and AMR studies in shrimp aquaculture. Okay, my first, I have two suggestions. First suggestion, and then I will end up with questions. Okay, first suggestion, I recommend we have a standardized methodological approach. We should have a methodological approach and standardized methodologies for the AMU and AMR, what we are doing in Malaysia, so that we can produce data that can be compared globally, to be used globally. So we have to look into that. We must have a standardized methodological approach and standard to be used, not only in the animals, not only in the human terrestrial, but also in the aquaculture sector. So we are lacking in that. And then the second one, I want also, we concern on the data interpretation, the antimicrobial resistance that we found in different sectors. could be from a combination from other sectors. So we should have a mechanism to confirm that when we found, let's say, in animals, whether it is really from animals or from humans. So that means we should have a mechanism to work on that, to conclude that this antimicrobial resistance is not necessary from where we found. It could be from other sectors. So these are my second suggestion. And then my questions. My first questions, our AMR action plan, how much it reached the end users? Are they know that we have action plans? We have so much of programs, so much of events going on globally. Are they reaching them? Are the term antimicrobial resistance, they know or no? They understand or not the term antimicrobial resistance? So we should concentrate on the term we use to make sure this effort reach the end users, especially the farmers with lack of knowledge about antibiotic and antimicrobial resistance. This is my first question. And then the second question, I want to know, fish falls under animal category or it stand alone as a aquatic animals? Because just now the presentations more talk on the poultry, duck, like that, right? So I don't see like a fish comes under animal. So is it included in the animal category in the My AMR action plan? Thank you.
Okay, I think that your question should be addressed by both Dr. Vignesh and Dr. Rohaya, because Dr. Vignesh may be from the health side,
okay.
and Dr. Rohaya from the DVS side.
Okay, for a disclaimer, before I start answering, when you want to ask question, just ask question. Don't explain some more. And you answer your question. Okay? Alright, first thing. During COVID, how many of you saw me in TV? Selamat Pagi Malaysia, I ada cakap 7 kali. You all ada tengok tak? Nampak tu? So, the information was given in that channel, but you all didn't watch. Same thing in the public. Now I consider you all public. I spoke on all the radio about COVID-19. Did you all listen any? Ada kan? So, this is what happened. Bila kita bercakap dalam satu channel, hanya orang yang ada di channel itu yang dengar. Tapi adakah kita buat atau tidak? Memang kita buat. Dengar atau tidak, terpulang pada masyarakat. Itu pertama. Kedua, adakah itu interest pada mereka pada waktu tu? Sorry ya, my Malay came out. Jadi orang, okay? Because kadang-kadang when you are, this one, your Malay have to come out. Okay. English, you tak boleh nak ni, tegas sikit kan. Ini tegas sekarang. So sekarang ni kan, you kena tegas. Adakah antimicrobial resistance masuk ke dalam public? Memang ada tidak, kita tak ada buat research. Dr. Vignesh is not from Institute Perangai Manusia. Ada kan? Okay. Okay? I don't remember everything. Okay. But, did we do? Yes. We do awareness in all the channel. But whether you are free at that time to listen or not, I cannot guarantee. Faham tak? Itu kengkangan yang mereka ada sebab ada orang kerja pada time tu. Betul? Ada orang tengok sinetron yang dia suka pada waktu tu. You get it? Because today, you see, when I was young, there was only one channel, two channel. RTM 1, RTM 2. My father was in the army, so we had the TV in the house. Hitam putih. Right? Itu dua channel. Sekarang ada berapa banyak channel? Astro, Netflix, RTM 1, 2, 3, 4, and then 7, 8, 9. So, waktu Vigneswaran bercakap dalam TV, dia orang tak minat Dr. Vigneswaran. Selamat Pagi Malaysia dia tak tengok. Dia lihat Netflix. So that's the reason. Are you all going to change that? I don't know. I don't know. So the thing is that how are we going to change people based on what is important to them? Create a need or create a fear? I think that will answer all your questions lah. Okay, kehendak kamu belum tentu kehendak Malaysia. I dah jawab yang lain. Thank you. I'm talking as a politician here. As some. Now, when you put a hat of a politician, you must understand that what is the priority of the country now? At this point of time. Beras tak ada. Bukan beras tak ada, beras ada. Beras mahal sebab import. Itu je. Faham tak? Okay. Jangan pergi ke sana. Balik ke AMR. Balik ke AMR. Okay? So basically, the usaha memang ada. Kita ada veterina. Okay. Do you all know tomorrow what day? Tengok. Besok is Maulidah Rasul. And then World Rabies Day. Besok dalam Selamat Pagi Malaysia, dalam bernama and all the channel ada bercakap tentang rabies. It depends you nak dengar atau tidak. Alah boring lah Selamat Pagi Malaysia. Tengok Netflix lah. Okay? So basically is what you want and what is your interest in that point of time. Kalau interest besok I kena pergi kerja juga, takkanlah dia nak lihat Dr. Vignesh dalam TV besok. Okay? So basically kita ada buat. Semua usaha kita ada buat. Bukan kita tak buat. Itu memang kita punya tanggungjawab. Kita ada Health Education Department. Okay? Thank you.
Okay, I will answer, I think the last question first about the fish or aquatic animal, is it whether covered or not? Actually, who's the responsible for the fish? Okay. Actually, in our ministry, KPKM, we have different department, DVS, DOF, Perhilitan also, right? So actually, for the disease control spirit, yes, we cover. At first, we cover all species of animal, but now yet fishery already take fish from us. So it's already under DOF. Okay, but in our NRC, there are activities regarding which regard the DOF, DVS. Actually, we did our MR on livestock, but fishery did on fish or aquaculture. Yeah, so is it answer your question? And my presentation just highlight on livestock because I didn't get the data from the DOF. Suppose if you give me, so I will include in my presentation.
Okay, I know the fishery people lah because we are in the invasive alien species group. So basically, the fish culture, invasive alien species kan. So they have a department where all the experts of fishery are there. Right? Now, what is the effort that's being made now is integrating all this data. It'll take some time, but everybody ada pengkhususan dia. Kita tak nak pergi cakap, oh, you kena bagi pada MOH. Right? Now, for your information, at one time, DVS and Ministry of Health was under one umbrella. Where? In IMR. Before our independence. Now they are one because they produce livestock. They went to agriculture. So all this fishery department pun ada. So when you come to a higher level where you mix with the higher sikit lah, you will know the scenario. So whatever your assumption of whether they are happening or not, it is happening, because why? We follow what is our member of party. They call it biodiversity framework. Biodiversity framework. Yeah. Okay. 2020, 2030. Dalam tu ada semua. Ada semua dalam tu, and then we work together. Right? So basically semua ada. Cuma kita yang belum tahu lah. Yang tahu dah tahu. Thank you.
I would like to add, thank you for your recommendation. I think it is very important to look at the awareness and education. And I like to add, at this time and age where people don't only look at one source of media, the TV channels or whatever. So maybe the TWG1 needs to look at other means of effective communication. When now people use TikTok, use influencers. If you want to spread and you're really compassionate about addressing AMR, not only in humans, in the environment and the One Health approach, we have to look at what attracts people now. Who are our audience, and how can we reach all of them at all age group and at all education levels. So maybe this is one of the avenue that TWG1 in that group has to look into. Okay, and I just want to add
1 minute before. I already got an idea. Skibidi toilet. My son watches Skibidi toilet. So we should recommend them in putting in all this AMR thing, because it's toilet one. Then the most number of contaminated Enterobacteriaceae group is in the toilet. Fine. So basically, as what Dr. Rafiza say, we have to be innovative in getting the information there to the new group of people lah. It's not that we don't want to do, but macam I buat TikTok boleh ke? Kita ada arahan tak boleh buat. Okay, thank you.
Because we have a lot of players, the academics, other as well. Because if not, the information that gets out may be not correct. Yeah. So for the school children, maybe we can get the KPM.
You should be a champion. You should be champion. If you got any passionate now, media is no more close. RTM saja. Tak. TikTok ada, Instagram ada, and so on. You build. If you got an interest, do something, be creative, and then reach out the public. And it's free.
Actually, in DVS, we always continue our awareness program, actually. And besides that, we also have meeting with farmers and also with animal industry, at least two times a year. So during the meeting, we give all the information about AMR. Yeah.
I would like to add one more thing about your PWG on research and surveillance, because for environment, for human it's quite straightforward, because we have patients coming into the hospital and things like that, so it's easier. But for environment, the information can come from multiple sources. So there need to be a way that people who has done research on AMR in the environment can also add on to the surveillance that's being done in Malaysia, because we have from the academia, we have from research institutes, and we have other agencies that's doing the studies. So how to get that platform and who will be collecting all those data. So that is the other thing. But I think, are there any other questions? But as the World Environmental Health Day is that we have to stand up to protect everyone's health, and each and every day. And also with the team of our research today is saying that tackling antimicrobial resistance is our responsibility. So I think each and every one of us has that role to play. Yes, Miss.
Very good morning. I'm Sashila. I'm an infectious disease doctor from University Malaya, and I'm also in one of the technical working groups under Ministry of Health. Thank you very much to all the presenters. I think it was a very interesting talk, and it was an eye-opener as well. One of my questions is, being in the technical working group, I know there's very good surveillance now, or better surveillance, and there's collaboration between the different ministries. But I was wondering whether all this information is available in a public domain. If we want to educate people, I think one of the things we need to start showing is the urgency of why we are doing it. We just can't tell people do this, but why we are doing something is important, and that's what we learned from our pandemic that we just went through. So I was just wondering whether there's what do we have out there?
I have to ask the policy speakers. Because we are from the research institute, so.
Ini yang jadi macam policy maker lah. Okay, so sekarang ni kan, we have all the information, all the infodemics for the public awareness in our Ministry of Health website. You can go there and you play around, look for the infographics. We have all our guidelines there, all our public awareness that we do. Even tomorrow we are doing one. This Sunday you all come to Titiwangsa, I'm there. Basically we have all the information that we talk, we give and all in MOH. And we do very regularly this awareness. But only thing is that sometimes you tak tengok lah macam agenda program tu kan. Dulu surat khabar kita beli, we see the program kan, RTM 1, RTM 2, RTM 3. Dulu mana ada handphone semua-semua. We open the paper and then we see the program there. You get that? Huh? When I was young, cuti sekolah je, open Tom and Jerry pukul 7. Cuti sekolah bangun awal. Hari sekolah tak boleh bangun. You get it now? So basically the programs are there. You have to seek and use it. It's not that I'm keeping at my bag. Dr. Vignesh simpan semua information, tak nak bagi tahu. Okay, so basically all the information are there, and then it has been simplified for the awareness use of the public. Because I have done public awareness for the orang asli also. You get, huh? I've done it orang asli, I've done in intellectual people, I've done with many groups of people. So my bosses more or less to become like that lah, right? But again, sometimes when you go there, you are not friendly to the people first few minutes, they takut already. So usually when I go to a place that they don't know I'm a doctor, I don't introduce myself as a doctor. You get it or not? I want to observe what they want. That's why all the talk that I'm going to give talk, I come and sit behind to see the crowd. So that I tailor what I want to talk to the crowd. That's how you should be. Not that I go there, I'm Dr. Vignesh Mutu, I'm from zoonosis, I do infection prevention control, they will stop. They will shut down. But I go there, I just say I'm Vignesh. You get it or not? Yesterday when I went for the talk tailor, first two all high big gun. All dia this one baca dia punya CV je 10 minit. I cakap, you jangan baca CV, you cakap Vignesh Mutu. Kalau dia nak tahu dalam Google saya ada. You Google this one, all my talks in whatever they or everybody posts. You boleh tahu. So we going there. So basically, don't worry, we are doing our level best to create awareness among the public. Because why? My boss last time told me, if the public don't understand, it's not the public fault, your fault. Dr. Roslan Isha, I remember because he nailed it into me. All right, thank you.
Okay, thank you very much. Due to time constraint, I have to end this session. So we have come to the end of a fascinating day of Environmental Health Forum. I would like to thank the panelists for their thoughtful remarks and insights shared, which have shed light on the critical issues of antimicrobial resistance, which is undeniably a global public health concern. The panel discussions has stressed that multi-sectoral approach would be able to effectively address AMR, and that it emphasizes best practices, innovation, education, and awareness efforts. The take-home message from this forum is quite clear, I think. Tackling AMR is our collective responsibility. We cannot afford to let our attention be diverted by problems that may seem more pressing at the moment. Consequences of unchecked AMR are far-reaching and demands our immediate attention. So I pass the session back to the MCs.
Thank you to our moderator, Dr. Rafiza, and all the panels for the illuminating and engaging discussions. Now we would like to invite Dr. Rafiza Shaharuddin, the head of EHRC, to present tokens of appreciation to our speakers. First, please welcome Dr. Vignesh Waran to receive the tokens of appreciation. Next, please welcome Dr. Rohaya. And lastly, please welcome Dr. Rosita to receive the token of appreciation. Thank you, Dr. Rafiza, and all our panelists.
We also have provided e-poster and publication related to AMR in the QR code on the screen. Now our event has come to the end. I hope you had a fruitful day and gained valuable insight throughout the forum. Thank you very much. And before we part, please accept this verse from us. Kalau ada jarum yang patah, jangan disimpan di dalam peti. Kalau ada silap dan salah, harap sudi maafkan kami. Which roughly means, please forgive us for our shortcomings. To all participants, lunch is provided at the ballroom, so please be sure to enjoy your meal. Also, kindly remember to complete our feedback forms, which will be emailed to you later in the evening in order to receive a certificate of attendance. So now we would like also to wish all of you safe journey home, especially those who came outside of Klang Valley. So before we go, please everyone stand and move towards the center of the auditorium for group photos.